Only the opposite. You're good.
Okay. All right. Good evening. Today is December 9th at 7 o'clock. And we are starting the warrant committee meeting. We'll take a roll call vote.
Zella here.
The rock here.
Joe Hunt here.
Steve Callahan present.
Pete Saladino here.
Ashley Leduc present. McCabe present.
Peter Michelson here.
And Brent is going to be joining us shortly. So
Okay.
he'll be here in person, but he said he was going to be a few minutes late. So this meeting is in hybrid format. It's also being recorded and will be made available on the website subsequent to the meeting. Our agenda is a pretty packed agenda. We have some minutes to approve. We're going to talk to Cook and Company. Thank you to all the people who sent in questions. We had quite a few, I think 4 or 5 people sent questions. So, and then we will talk about OPEB, and then the discussion of the capital budget will depend on Megan is going to join us probably a little before 8. And so we'll cue that one up when she arrives. And then talk about the structural budget deficit and free cash, and then talk about local receipts and the updated forecast, and discussion of the budget guidance to departments. And I'd like to vote on that if we can. And then talk about there was a proposed date for an upcoming meeting, so we'll talk about that, whether we should have that upcoming meeting and what date it would be. And then we have a draft FAQ document that finance team has helped draft, start a draft of, and then just get some committee updates, I guess, from the committees. So that is it. And we start. Oh, did everybody? Let me see if I can. Okay. Hopefully, I think I sent it to everybody. The revised minutes from the infamous November 17th meeting where the recording evidently didn't happen. That we kind of put these together with our memories. I sent around a revised draft of those with my edits to Emily's excellent summary. And I don't know if did you get any other edits, or was that pretty much it? Just ones I sent. Did you give some? Okay.
Super minor.
Okay. All right. So, is there any other suggestions, comments on those minutes?
Just really impressed she got it done without a recording.
Yes. Yeah, it was very impressive. Or AI. So thank you, Emily. I'd entertain a motion to approve the November 17th minutes then.
So moved.
Okay, is there a second?
Second.
All right, all in favor, say aye. Aye. Okay. Okay, great. Well, that's taken care of. I believe Brent is supposed to take minutes tonight. So he'll be interested in the recording.
So we should stop talking about rent.
Yes. And my assumption, tell me if I'm wrong, is that the December 2nd joint committee meeting will be those minutes will be taken care of by select board.
By me as well, yes.
By you or someone in the town finance. It will, yeah, okay.
AI.
In other words, we won't have any responsibility to edit those.
Well,
So we will review them.
I think that all the committees should review it to make sure that everyone is agreeable about what they said and we're represented.
Okay.
So yeah.
Well, what
And
draft?
those will be circulated as a draft, and then each committee can approve them. And then once the last committee is approved of each one.
Okay, good.
Minutes, who are you gonna blame? How are
We'll see. True.
Good evening, Brent.
Hi, Brett.
Let the record show that Brent has joined us, is present. So that, I guess, takes us to, so the calendar hasn't changed. We still have the same dates that we presented last time. So I think we're ready for the cooking company conversation with Mariana.
So we have Mariana and actually Danielle is here as well. So let me promote them to panelists.
Here's a list of questions that were final list of questions. There's a couple on the back.
And then Steve, you might want to just unshare your screen so that we
Yes.
so that
Yes.
yeah.
Let me. Good evening, Mariana. Can you hear us?
Yes, I can. Good evening.
Oh, good evening. How are you?
Doing well. How are you tonight?
Good, good. Thank you for taking some time to talk to the Warrant Committee here. As we, I'm sure you got briefed, but just to sort of level the playing field, as we undertook our due diligence on the FY27 budget in the fall, it quickly became obvious that the health insurance was a budget buster this year, and triggered all sorts of other discussions. And in the last year, we saw like a 17% increase, and we're looking at like a budget of 18% increase this year. And I'd love to hear your opinion, but I think we've been told by others to expect similar increases in the next couple years. So we thought it would be important to have a dialogue with you as our town's consultant to just kind of, we sent you a list of questions and of kind of things that the committee was interested in understanding. So I don't know how you'd like to proceed. Do you have things you want to talk about first and then dive into some questions, or how do you want to go about it?
Yeah. So maybe we start off with an overview of the market dynamics and what have really contributed to these high increases, such as what you've experienced with the 16.92% increase for FY26. And then we can go more granular into the questions that have been posed. So I'm going to turn it over to my colleague Danielle, and she'll provide a general overview. And like I said, then we'll jump into more of the details.
Okay.
Good evening, everyone.
Good evening.
Thank you. Thank you very much for having us tonight. And, I did see the list of questions, and they're all very, very valid. And, as we all know, healthcare inherently is so difficult to navigate. And the past 2 years, particularly, we've seen some unprecedented trends, both in Massachusetts and even nationally. And so, certainly in working with municipalities across the Commonwealth, we are looking for new ideas and trying to help educate folks on, why costs are what they are. And so I think a good place to start is really looking at the healthcare premium and why costs are fundamentally rising. And there are so many factors, and it's complicated and so forth, but one major factor is the increased demand for healthcare services. So, we're seeing rising costs and chronic disease, which is impacting rates, an aging population, more expenses related to behavioral health and primary care shortages, inflation, and of course, medical technologies. The more technologies that are developing, the more expensive care is from a delivery standpoint. And then, overall higher prices for medical procedures. And again, some of the factors that I just mentioned also cross over into this realm as well, including inflation, labor shortages, costs for equipment and administrative expenses, which is why we're seeing increases in hospitals, especially in Massachusetts, where we have, systems like Partners Health that really, account for a monopoly when it comes to the negotiation with insurers. And then, of course, I know there was a particular question about rising costs related to prescription medications. There are a number of new therapies and medications related to specialty drugs, spending, formulary changes, and so forth. Of course, I'm sure we all know and we've seen on the news, many of the attention or much of the attention has been on the rise of GLP-1 medications for weight loss. These have been, an unprecedented strain on budgets across the board, whether we're talking about public sector or private sector. And there's certainly been a response to eliminate those drugs that we're seeing right now. But I think we can say, next year, there'll likely be a new class of drugs, whether it be particular to weight loss. Pharmacy is certainly a moving target that we need to plan for and account for going forward. And then, from beyond looking at the purview of why the health insurance premiums are rising, we then have to look at what's going on in the marketplace, particularly in Massachusetts. As you may know, over the past few years, there's been a sharp turn in insurer consolidation. So we now see Harvard Pilgrim and Tufts coming together as Point 32, which has limited competition in many ways. We've seen Fallon exiting the marketplace. Some of our work really is looking to, can we leverage national carriers and what options may be available in the future, because many of the national carriers aren't really servicing the mass municipalities right now because of the dynamics with the local carriers that have existed in the past. But this has certainly overall limited options. And then, of course, the hospitals, there's been quite a bit of mergers and acquisitions on the hospital side, making it more difficult for insurers to negotiate. And, also effects on Medicaid as well, and reimbursements in the state, which is driving up costs for providers. So those are really some of the key reasons. We look at sort of the totality, and certainly, pharmacy has been, garnering quite a bit of attention and trying to get ahead of managing these costs going forward, which has certainly been a focus of ours. And really looking at chronic disease management and really trying to work with municipalities to see why costs are rising for their specific profile. Is that due to cancer, diabetes, musculoskeletal, and how can we bring in different programs to address that? Because at the end of the day, the days of relying on the insurance company are honestly numbered. We really have to look at how can we better manage each employer's specific population. So that's the 64,000 foot overview. I don't know, Mariana, if you want to add anything.
No, I think that summed it up perfectly. And, I'll certainly leave it to the board. We can start jumping into the questions, or if you want to go into a specific order and get more granular. I know certainly, I think the next question will be, where else do we have the opportunity to place our health insurance? Happy to proceed. Or if you have a specific order you would like to go in.
No, I don't think there's any preferred order. So
Okay.
as long as we cover them all, that's fine.
Okay. So right now, to level set, you are with MIA, the Massachusetts Interlocal Insurance Association. It has over 150 entities, and it's a purchasing group pooling claims. The way that they operate is you can pick your own plan designs. They also pick the carrier and PBM. Right now, it's with Blue Cross.
Excuse me, did you say you cannot pick your own plan design?
You can. You can.
You can. Okay.
Yes.
Okay. Sorry.
can.
All right. Got it.
But what they do control is things like the carrier. Right now, it's with Blue Cross Blue Shield with a carve-in for PBM through CVS Caremark. They showcase what wellness and population programs. That is all in their purview, not in yours as an individual entity. And then the other difference with Maya is how your rates are set. You are blended both from a group claim perspective, so what your utilization and experience is, and the overall pool performance. And every year they provide a minimum, a low and a high band that you can fall in between. So what that means is if you have a bad claim experience, you are protected. There is a maximum. So by way of example, this past year, the maximum was 19%. And so you fell below that with your 17%. Certainly, there were entities that were much lower at the lower end of it, but on average, they had about a 14% increase. So that's where you are today. There are some limitations, but there are certainly those pros that we talked about. Where can you put your insurance elsewhere? You could go on your own. You could be fully insured, which means you pay a set premium to a specific carrier, such as Blue Cross Blue Shield or Harvard Pilgrim. They take on all the risk, whether you have a good year or a bad year, but you are limited in that capacity. You could be self-insured, though you are on the smaller side, which means you take on all the risk and the volatility of the plan. If you have a good plan experience year, you would be able to benefit and use those dollars and capitalize on them in your trust. If you have a bad plan year, you are on the hook for those claims on a monthly basis. So that is a lot of risk being a smaller group and something we'd probably not recommend. The other options that are a little bit more feasible is joining another pooling a group. So there are regional ones, and then there's the state one. Regional examples include West Suburban Health Group. It has about 10 communities today, such as Denham, Dover, Natick, Wellesley. In addition, Southeastern Massachusetts Health Group, while their name sounds regional, they've actually removed that aspect and are accepting entities across the Commonwealth. They also have 10 communities ranging from Rentham to now I'm just blanking on the names. Yes, I'm Danielle. Can you jump in? I'm completely drawing a blank on the rest of the SMHG communities.
Norton is one of
Norton,
them.
thank you. Norton. There's a few. There's a number. I apologize. I'm just completely drawing a blank. So they have that. The benefits there is they both work with Blue Cross Blue Shield. However, they set the plan designs. They both offer 6 plans, both HMOs and PPOs. You would be able to elect any of the 6 plans to provide to your membership. But because they are larger, because there's roughly 10 communities that come together, they pool their claims. They're also able to control the experience if there is bad years. You are a board member, so it depends on the size of the group. You do get a vote, you do get a say, and then they do both have relatively healthy trust funds. So if they are having a bad experience year, they could artificially set the rates just a little bit lower and dip into that trust. Certainly, that comes with fiduciary responsibility, and there needs to be some oversight on that piece of it. And then finally, there is the GIC, the Group Insurance Commission. So the big difference with the Group Insurance Commission is they are required to accept everybody that applies and goes through the process. The regional joint purchasing groups, they are not. They could assess your risk and say that you are a high risk group and we are not going to accept you. They could assess your risk and say, we'll accept you, but with a buy-in and determine what that is. Or they could flat out say, no, this is not something that we're interested in pursuing. Because the GIC does accept all entities, they do have a December 1st deadline that you have to have everything squared away. So that's kind of the nice part with them is the other pros of the GIC is municipalities, they provide set plans. So they have 8 non-Medicare plans and 5 Medicare plans that your members would choose from. They handle a lot of the administration. So they have a centralized member services, they have enrollment management, plan management. So that would help, those tasks would be taken from the town and they would take care of that on your behalf. They also handle all the procurement, vendor contract, renewal negotiations, things that would come off the town's plan if, say, you were fully insured or self-insured. They handle all the compliance matters, so anything related to ACA, the filings that are required to be done. And then just in general, they provide the supplement benefits, as do the regional joint purchasing groups of wellness programs and disease management support. However, unlike the joint purchasing groups that they have a trust to potentially dip into, or Maya that has that high and a low band that you'd be fit into, the GIC every year they do their renewal and you get no say in what that is. So they're going to evaluate the experiences and they're going to set the premiums. They could also procure, and that means, right now they have their set plan designs and their offerings. They can change that from year to year. In addition, they do not offer Blue Cross Blue Shield that I'm certain, certainly a lot of your members may be tied to.
Are we in a high band or a low band in Maya?
You were sort of in the middle. Their high end was a little over 19%, and you were at 17.
their history been similar to ours? Like 17% last year, 18 last year, another 18, and then 15 going forward?
Yeah,
Very
we're
similar?
expecting very similar for FY27. The one thing that we don't know of yet, and they are debating that as we speak, is will GLP-1s for weight loss be covered? And if they are not, will there be a population health program that members can still access them? That will certainly determine what the costs are. That has been a high driver, as Danielle had mentioned. If they are no longer covered and there is no program that members can still access them through, which means you're not shifting the cost and it would be a one-to-one for, that could certainly decrease the renewals quite substantially.
Maybe we're getting into this a little bit later, but have there been more communities going into the GIC or out? What's their
So that's a great question.
turnover?
Yeah, so over the last 5 years, there have only been 3 communities that have joined. However, for FY27, there is at least 3 new ones that will join: Malden, Grafton, and a small Charles River pollution control. In addition, you may have heard is Hampshire County Group Insurance Trust. They've had a little bit of insolvency. So there are a number of members that are looking at the GIC. They have been given an extension to get their everything in order at the municipal level. So there could be a few additional entities that do join from the trust due to that one-time extension they were granted. Danielle, I'm not aware of any communities that have exited in the last 5 years. Are you?
Not recently.
That's good.
Yeah, I
No.
mean, Quincy came out a few years ago. I actually was formerly at the GIC during the peak of the Municipal Partnership Acts, and I would say that since then, the majority of communities, with the exception of some that Mariana mentioned, really came in during that time. I would say most of them have stayed in. Like, for example, Grafton, they used to be in, they must have come out and now they're going back. But it's really been, sort of stable, if you will. I mean, certainly a lot of them undergo every 2 years evaluations to see if there are other market options. But a lot of the communities that initially went in all of those years ago just have had some tough experience, and it's really been the best place for them to be part of a larger pool like that.
And what we did for Medfield specifically is we did do an analysis what it may look like if you were to enter the GIC. The one thing, as mentioned, there are 8 different non-Medicare plans and 5 Medicare plans. We cannot predict exactly where your membership would enroll. We had to make educated guesses based on where your plans are today, your enrollment, particularly looking at the WellPoint Total Choice as the PPO option, the Harvard Pilgrim Explorer as the HMO option, and then the WellPoint Medicare Extension for your Medicare retirees compared to your Medex. We looked at comparing your FY26 rates that you currently have today, and then your renewal with Medicare for 2026 against the GIC rates. And ultimately, again, this is an analysis. This is just a snapshot. We can't be certain that this is where your members would fall into. But in that capacity, it actually would be more expensive, we predict, from a budget standpoint for Medfield and your members. And that's really because the plans that the GIC offer, their total rates are higher than the plans that you offer today.
And we also don't know. We're basing this off of FY26, which is always the challenge, right, of this analysis, at least trying to meet the December 1 deadline, because we can only go off benefit and rate information from the previous year. So the entire analysis is based on reasonable assumptions from every capacity of what we think trend might be. Are we anticipating any benefit changes? And, obviously also taking into account what we think your increase might be. So it's beyond just the migration, which is the hardest part, because we don't know where your members are going to go. So if the analysis is already suggesting that it would be more expensive, most likely with the way costs are and the increases that we're expecting, it most likely would be that even more going forward.
We're estimating the budget, it would be more expensive by about $400,000 or 7% just for the employer share, certainly incorporating the employee part of it as well. And the other thing to keep in mind is the GIC does not offer high deductible health plans. So they cap out their deductibles at 500 for an individual, 1,000 for a family. And so right now you do have those high deductible health plans. You do have an HSA match that you are providing your members. That would no longer be an option for them.
So if I understand what you're saying is, so the GIC rates must be going up at least the same amount that ours are going up,
Yeah.
right? I
We
mean,
don't know what those rate increases will be. I mean, they were notably high last year. I mean, I think they ranged somewhere between 9 to, do you remember, Mariana, like maybe 15 or 16%? And I
They
know
don't do a
that,
composite increase like Maya does for you.
yeah.
It's per plan. Their aggregate was 10.5, but again, certain plans did go up significantly more.
okay.
I know next to nothing about health insurance, but this is sort of counterintuitive to me. I would have thought that the GIC, by virtue of having all the state employees plus a bunch of municipalities, would have a much bigger pool of total number of employees. And wouldn't that therefore lead to lower rates rather than higher rates?
Well, I think the answer is that this is really about a product of why costs are rising. You know, the health insurance piece that I reviewed, I think it's less about the performance of the pool, if you will, because when you have, to your point, a large pool, you have this bargaining power, and then you have risk that's spread out, you know, over hundreds of thousands of people. The rates in the market are high, unusually high across the board, no matter how big or small.
What are we to make of the West Suburban Health Group? It seems like that's a bit of a collection of some higher income communities. Did we look at that in the past? I saw Needham, Dover, Wellesley, Dedham, Natick.
Is that, do you know anything about that particular group? The West Suburban Health.
Yeah, so it's Dedham, Dover, Sherborne, Natick, Needham, Wayland, Wesley, Shrewsbury, and Accept Education Collaborative. They've certainly been around for decades. They also utilize Blue Cross Blue Shield. The one piece, I don't know if they're accepting new members right now. I know they've gone through some leadership changes and have done certainly a number of procurements to stabilize their trust. But that is one question that if there is interest in exploring other regional joint purchasing groups, we would have to inquire. I know Southeastern has accepted and is growing. They most recently for FY26 accepted 3 new member units.
But what happens with some of these groups like that Southeast one is they make a decision. They say, yeah, we'll let you in, but you have to buy in.
Yeah.
Because you're a poor risk.
Yes, so those are the 3 options that could come down.
So we've been paying into the trust for X number of years. We want you to pay into the trust to get in.
Yeah.
So yeah,
We can ask, right? I mean,
so that's probably a huge investment to have
We don't
on
know.
your side for
You
the
got-
trust to get in.
Nobody knows.
Exactly.
don't.
It would have to be a conversation. They would evaluate risk. I will say for the 3 communities that did join SMHG for FY26, all 3 were not assessed a buy-in. Some were assessed certain clauses, such as they could not adopt any of the $0 deductible plans. They had to choose of the 6 offerings, they could not choose 2 of them with the $0 deductible plans. So there were some different clauses versus a buy-in. That's not to say they may evaluate your risk and say that you are bringing in high risk or you have high cost claimants that would impact their stop loss renewal, and they may assess you one. We don't know without having that conversation and supplying them your data.
Okay.
And we
So-
did not do that 2-3 years ago when we renegotiated, right, Brittany?
no.
Okay.
Yeah, no, we didn't go down that road. Okay, so that's an option. But let me switch gears a little bit and ask you about, let's assume that we're not going to get into the GIC because it's going to cost us money. Let's just assume, we'll explore, but let's assume we can't get into some of these regional groups. Is there any incentives that you've seen where towns have offered to one, either encourage employees to opt out of the health plan and switch to a spouse's plan, or make it attractive for employees to opt into a higher deductible plan and away from these lower deductible, high cost plans?
Absolutely. So to answer your first question, many communities have or are starting to introduce opt-out programs. You have to think about it though, is the plans are very rich, especially if their spouses may be with a private sector employer. So the incentive does have to be quite high. A lot of entities are going up to 25% or 30% of the total rate to incentivize individuals to opt out of their insurance. But even with that, they are still receiving very limited participation.
I see. People aren't taking them up on it.
No, but I will say, offering $1,000 for an individual and 2,000 for a family, you will not get any participation. It really has to be a significant value. But again, even if you're doing 25 to 30% of your total rate for the plan, you're paying that rate every single month, and you're giving them a one-time stipend, either per each payroll deduction, it's split out, or upfront. So while that may be a significant amount of money for them, overall, it's still, for you, you're saving quite a bit.
Yeah.
I mean, this is definitely worth implementing because there's no downside to it. Even if you got 5 people, if you add that up, that's significant.
Yeah.
I mean, I think you unfortunately can't rely on it as a primary strategy just because we have no idea and we just have seen a low uptick on it. But there's no downside to offering this.
Yeah.
Wait, can you?
So explain why.
I understand there's no downside because especially when we're in our own group here and we talked about how what was that term about how we're 103, but we want to be less than 100.
Our claim experience.
Our claim experience, and that if we have people opt out and they're more healthy, like there has to be like some downside. Like, right?
I mean, that's a fair point given that size, but we would not expect a significant number of people to come off.
Oh, got it. Okay.
Yeah, they're talking 4 or 5 people in some cases, which is not a big number, but
okay.
But
I mean, we've seen cities.
Are they allowed to come back in? When you're out, are you out forever or 1 year or 2 years?
Yeah, so there's terms that can be set. One immediate that comes is you do have to allow people to come back in if they have a qualifying life event. And that's why we generally recommend paying this out per payroll period so that if they do come back on, it just triggers that now they have premium. But you could also do it on a quarterly basis. You could do it on an annual basis, and they may just owe that money back. In addition, a lot of entities are setting that if you opt out outside of qualifying life event, you are opting out for a 2 to 3 year time frame.
Okay.
So that gives you some kind of, able to control your budget and understand that. The other provision that most communities do have is that you do have to have the entity's insurance for at least 12 months to participate in the opt-out program. And this, again, decentivizes individuals who are not on your plan to take advantage of it. So by way of example, right now, your Network Blue $500 deductible plan for an individual, the total rate is $1,102. If we annualize that, that's $13,235. If, say, you did a 25% incentive, that would be, $3,300 roughly you'd be giving that person to opt out. Which, again, even after we do the employer-employer split, that's still significantly less than you would have been paying for them.
And that 33 is over 1 year, just you're saying by month.
Yeah.
So it's a one-time.
I mean, the economics clearly work
Right.
if you do it. If you get somebody to do it, even at 25%, you're still saving money.
Sure.
Yeah.
They get the incentive for the first year though, even though they opt out for 2 or 3.
That would be up to you. We can we can certainly work with you to provide recommendations and what other communities are doing. You can do the payout every single year. You can do a one-time. You can do it as, a trial period and see what your utilization looks like, and then kind of go from there. You can always change the terms after the initial program rollout.
Now, does a change like that have to be, what's the process to get a change like that enacted? Like, does it have to go through the
You would have,
personnel?
yeah, you would have to go through bargaining.
Okay. So this is nothing that's gonna happen quickly.
Right.
Yeah. Okay.
We haven't seen a lot of pushback just because it is a benefit for individuals and it's
Yeah.
another opportunity for them. So from a bargaining standpoint, I'm not sure if your health insurance is negotiated within each collective bargaining agreement or you have one.
We have a group that represents all of the unions. But it's heavily weighted to the teachers, so they tend to get the biggest votes. But the interesting thing is, it seems like you wouldn't have to worry too much about budgeting for this type of a change because it would pay for itself within the budget, right? Yeah. Okay. We're just talking amongst ourselves here.
Yeah.
Sorry. Yeah.
Did you do that in Mansfield?
No,
No. Too good to be true.
It may be
Right.
policies, health insurance policies we offer are as good or better than many offered in the private sector.
Oh, yeah, I
So
get
people would not have much of an incentive to
Right.
switch.
It depends on your situation,
Yeah, but
right?
young
If
healthy
your
people,
spouse,
like, yeah.
if the spouse
Yeah,
works for
two
Fidelity or
kids,
something, I'm sure they have a great plan.
Right.
My wife's VA and we don't go through her insurance. My firm has better insurance than the federal government. So maybe there's,
Yeah, that's what I mean. I don't-
maybe there are
maybe
folks
there
out there
is a
like.
downside.
I don't know.
Okay, other questions, people? Sorry, I let other people
you
ask.
said earlier that the GIC does not use Blue Cross Blue Shield. Did you say who they do use?
So they have Harvard Pilgrim, they have WellPoint, they have Mass General Brigham, and
Oh,
Health New England.
And Mass General Brigham has their own insurance plan now. They've come out last few years.
We covered this last year. I had a question about why weren't we shopping outside of Massachusetts if the driver of the cost is the consolidation of the Massachusetts insurance companies? And you brought it up at the beginning of this conversation as a thing that we might consider, but we didn't really talk about it yet after that. Do you have any additional, is that something that we should consider moving forward?
We can certainly shop and include the national, such as Aetna, Cigna, United. Just keep in mind, again, right now you have about 321 subscribers across your non-Medicare plans. At your size, it would be risky to go self-insured. We'd be really looking at a fully insured model, and those have produced significantly higher rates than what you're able to achieve in Maya or any other purchasing opportunity. So while we can certainly do that exercise, it is unlikely to produce anything more competitive than what you are receiving with Maya.
You're a small pool. And those big players deal with big players.
Oh, but there's no other,
Yeah.
there's no other joint buying groups we can join?
Not outside the ones that have been named, such as Maya, the GIC, and West Suburban and SMHG. There are a few other regional joint purchasing groups, but they still consider their territory, and you would be outside of it. For example, Cape Cod, Berkshires, Mayflower, your community is outside of where they target.
The Southeast and then,
We would have to look at like what is covered too, because like I used to work in insurance and like when you're in a local insurance company, your network is like much more rich versus if you're on a national plan. Like I just recall when I worked in this sector, like that then your local network is not going to be as good because they're like, negotiating nationally with providers.
Yes, we would certainly do a
But I
disruption.
mean, like, so, but I thought of it too, like, cause I was like, oh, I'm reaching for anything.
Yeah.
But it definitely would be like something we'd have to look at to provide similar benefits,
Yeah, I mean the networks, it's a fair point, and we would do a disruption analysis no matter what carrier we looked at. But it's just important to keep in mind that, on the private sector side, Aetna, United, Cigna, they're all major carriers on the commercial private sector end of the spectrum.
I don't know, I had a plan around here before I started working locally, and it was way different. Your network, in network, out of network is like way different.
It
Yeah,
can be.
price difference.
When you're on, no, well, who is in network? When you're on a Blue Cross Blue Shield of Massachusetts plan, as I am now, everybody's in network. I don't have to worry. But when I was working for like a corporation in another state, and I was on a national plan, every time I went to the doctor, I had to be like, are they in network? Or are they not in network? Like,
Yeah, I had Aetna as well.
it was really, that's a real,
Yeah.
it might save us money, it might not, but either way, it's something you'd have to consider for employees, because it's a, like, and maybe that's different now. I'm going like, I'm aging myself, but that was definitely a thing.
And it still is today. You know, most networks at this point have pretty full coverage. But again, if we were to do that kind of analysis, we would include disruption for your current utilization. The one other thing that the question that came up earlier, I don't want to skip over it, is how can you incentivize individuals to take some of your lower cost plans? Right now, you do offer 5 plans, and for your size, I think a lot of people are creatures of habits. The plans that they have, they're going to stay. They're not necessarily going to explore the other options, including the 2 new ones that the community introduced. So that could be something of consideration, is potentially do some consolidation on the offerings.
Yes, I know a lot of in the corporate world that happened. They ended up getting rid of these very expensive
Yeah,
plans.
and I think it's
They just didn't give you the
unless you
choice.
have an active open enrollment, most individuals are not going to shift. And that's sort of what you saw for this year, is you only had 13 individuals enroll in the 2 new offerings.
Which is not what we wanted.
No.
Yeah.
Do we do any kind of town funded health savings? We already do that.
So I think that the next plan design, we probably should look at reducing the options.
Mhm.
I think that would be
Wouldn't that have to be collectively funded?
yes, yes. But, you know, there's always going to be a few people that want the plan they've had for 10 years, but, you know, we offer these new plans because they're cost effective, right? For everybody, for the employer and the employee. And, you know,
Not enough people.
if you,
So I'm just, off the top of my head, I'm thinking if the town's saying we want to drop the 2 high-end plans, and we also want to have 2% collective bargaining. And they say, we'll take the 2, but you gotta keep the health plans. We'll go, okay. I think, right? I mean, I don't know. I mean,
I don't know. I don't know.
speculating,
Yeah, I don't
of
know.
course, the future bargaining, but
Yeah.
I'm just thinking that will not be an easy bargaining session. I don't know, maybe it won't be as hard as I imagine.
Well, keep in mind that you know, the employees are paying part of these 18% increases. So, you know,
Do you happen to know if the town or the school every year has some type of a seminar where they go over health and
They
people,
do, they have like a fair, like a benefits and health fair.
Yeah.
where they explain all of the
Yes. Yep.
plans? Okay.
so you're familiar with all our 5 plans. Which one's I call it the Cadillac plan?
So your most expensive plan, just by a few dollars, is your Blue Care Elect $500 deductible plan. So that's a PPO plan where you have in-network and out-of-network benefits with the lowest deductible of $500.
And
We
that's
do
the
have
one
other
that,
plans with a $500 deductible. I don't want to misspeak on that capacity, but that is your richest or your Cadillac of the plans.
the Blue Cross PPO. And that's the one we have the most people in?
No.
No, that's just your most
Oh, the-
expensive plan.
Okay. So that could be a candidate for.
We do have to be careful under Massachusetts General Law 32B. You do have to have at least 1 PPO offering. And the primary reason is you may have non-Medicare retirees outside of the service area. So they may have retired and moved to Arizona or Florida, and they do need an offering. It is required by law.
Yeah,
I think it changes.
that doesn't need to be the existing one
Right.
with a $500 deductible.
No. And you could also introduce a stipulation that only that population is eligible for the plan. So anybody who is not a non-Medicare retiree living outside of the service area cannot enroll in it.
Yeah, okay. Yeah. Yeah, no, this is good.
Does the HSA cover the full deductible on the high deductible plan?
I believe it's 50%.
Yeah. Has anyone played around with covering 100% just to make it a driver? Because what is that, another $500 a person?
We just introduced that at that last, when was that, 2022? So that was what we elected at that point. We haven't like gone in and changed it or looked at it again.
Yeah, it helped drive folks.
Yeah.
So
And 50% of the deductible is the most common.
That's actually what we did.
Yeah.
Was we wanted to move everybody into that, and we said, okay, if you go into this, we'll cover.
Yeah, that's what my employer has done.
Definitely save money.
Yeah.
So,
So there's one question we haven't talked about.
The towns fund
Yeah.
the percentage of the deductible, like the full percent of the deductible. We pay out of pocket through a health savings account. So the person taking the benefits doesn't have to come up with the cash.
Yeah.
You know, like you park it for them, it's in their name, but they can draw from that.
Yeah.
Whatever the deductible is.
So the other question that we had was it kind of when the people who did the OPEB report this past year, they identified 12 retirees or covered spouses who are over the age of 65 and they're enrolled in the active medical plan rather than the Medicare supplement senior plans. And we wanted to get your opinion on, the consultant said we should look at, potentially doing what they call buy-in for retirees who would otherwise be ineligible. Have you seen anybody do that? Is it feasible? What's your opinion of that?
So we've absolutely seen communities do that, but only if it financially makes sense. So for Medfield, we did do an analysis. I'll just go over it at a very high level what it would mean. So instead of paying the employer non-Medicare portion for these individuals, you would be covering their entire Part A premium, their Part A penalty, their Medicare Part B penalty, and the employer portion of their Medicare plan. In doing that analysis based on the 2026 premiums that came out, it would actually cost Medfield estimated $70,000 more per year. Again, that's without trend. Every year it's going to increase. Most of these penalties are lifetime. For Part A, you pay the penalty twice the number of years post 65. For Part B, it is a lifetime penalty. And as you know, the costs for Medicare are rising every single year. So based on your current premium splits and the total rates, we've actually determined it would be a cost, not a savings to Medfield for these 12 individuals. The other piece I just want to put in the human aspect of it is these 12 individuals are in higher ages. They may not necessarily be in a position physically, mentally to fill out paperwork and go through this process. So I do want to be sensitive to that aspect as well.
Yeah.
That's hard for a lot of people at all ages.
I understand. And again, these are 12 individuals. The harsh reality is eventually they will pass away and fall off. We don't know what that timeline looks like for anybody, but that number will start to decrease, and it's unlikely. You may have one or two more that retire, but you know, few and far going forward.
And if you do this buy-in and they die a couple years later, you don't get a refund, right?
No. And then the other thing is, just from an administrative perspective, is CMS requires a minimum of 20 people to pay for their Part A and Part B penalties directly. Because you don't have at least 20 individuals, you would have to reimburse these individuals, which could get very complicated for them financially if they are paying that Part A premium, that Part A penalty, Part A premium, Part A penalty, and Part B penalty directly every single month, and then waiting for a reimbursement from the town. that
Yeah.
may not be, they might not just be able to sustain that.
These communities you said you've seen do it, what was their situation? They obviously must have had more attractive, it saved a lot of money, or?
Yeah, that's a great question. So generally, it is larger communities, and for them, they were what's called self-insured, meaning they were taking on all the risk. So instead of
Okay.
evaluating from a per premium perspective, we were doing the cost for the Medicare migration portion against what these members have been utilizing for claims. And if the claims, because that's what they pay every single month, not the actual premiums, exceeded the costs, then that generated a potential savings. Obviously, we would be looking at historical utilization of the most recent 24 months. Utilization can change at any given time. It is just a snapshot, but based on the information that they were presented, and given that it wasn't just one or two retirees that were experiencing large amount of claimants, it was a majority of the population that was eligible to go through Medicare migration, it made sense for them to pursue. But just as many communities, whether they're self-insured or in an arrangement such as yourself, it has not made sense for them, and they have chosen to reevaluate this potentially at a future date and not proceed at this time.
Yeah, I guess that makes sense. If you're self-insured, it would save you a lot of money, I guess. Yeah. Okay.
And again, even then it doesn't. I've seen communities we've done this for and they're self-insured, and I'm just making up numbers. They have, 25 people that would go through this process, and really it's 3 retirees that are experiencing a lot of claims and the rest are not. They're just doing, a few prescriptions, maybe a checkup, a surgery here or there, and it really just financially did not make sense to do that for them.
Okay. All right. Are there any questions online? Okay. Any other questions that people have?
I was wondering about the pharmacy benefits, like, is that something? So I think you said we do the. Oh, Maya controls it. That was the answer, right? So as long as we stick with Maya, we don't have any control of the PBM.
No, you don't. The only
Yeah.
part that you can control is your plan design. So the co-pays or co-insurance that members are charged, you can certainly bargain for that. But the actual pharmacy benefit manager, that's Maya's responsibility.
Okay, that was the answer. Forgive me.
Yeah, I just took a quick look. I don't think there's anything that
I
we,
think that covers.
they covered just about all of them, right? Yeah.
Let's just look.
Well, thank you very much. This has been very informative and I think very helpful. I think we've got a few ideas to pursue longer term, I guess. So thank you again.
Yes, thank you very much.
Yes.
Thank you.
Danielle and Mariana, thank you.
Thank you, guys.
Okay, see you later.
Bye-bye.
Bye-bye. Okay. That was interesting.
When do we decide on plan changes and stuff?
I think we have to wait a year because we just did it.
Okay.
So there's nothing, I've concluded there's nothing we can do for the 27 budget.
Okay, that's what I
We're
was
kind
curious
of
about,
stuck.
like, do we need to?
All this stuff is 28, after
For
27.
Okay.
Yeah. But when you get told that it's gonna be 15% a year for multiple years.
Right.
Yeah,
It's
it's
worth
really
looking
stuff.
at. Yeah.
And I think to address like what the school committee was saying about the opt-out, I think like we should probably let them know that we asked about it, but it's unexpected to be a significant amount, at least based off cooking company. But certainly it doesn't sound like there's a reason not to offer it, but I don't think that we could like have the budget necessarily assuming that we're gonna make a ton of money on that based on what they said.
That's just
Right, which is what they were looking
No, I think
for,
that, yeah,
right?
that's
Like,
just some, yeah, I don't think, yeah. But and plus it takes, you have to bargain
You have
that
to
too.
bargain
So
it.
it has to go through that process.
who we're looking at. So
Yeah, but I think,
it's not gonna help us
Looking
right
into
now.
all of
even if it's 5 employees though, that's that's like probably what, 100 grand? More than 100, probably more than 100.
Town's portion.
Yeah.
Is the bargaining window only at that renewal for 2028, or is that something that can be introduced anytime?
The bargaining would be at the next renewal,
Okay.
next when we are looking at that newest agreement. When that one's up.
You can't do like an ad hoc.
No,
Let's discuss this.
yeah, that was part of the terms that we covered under that, so.
Why was that not pursued before?
We thought the plan, I mean, remember when we did those plan design changes, we saw a -2% increase. Or what are
The rates, yeah.
the rates.
But we thought more people
And
would
so
opt.
we thought that, you know, we
Oh.
thought we were in such a great spot at that point, and
Got
then here subsequently, the next year, we had that 16%,
Well,
0.9% increase, so we thought we were in a great spot.
the
where we
rates
were,
went down, but as like she said, not many people switched.
Yeah.
To these
and
new,
not many
these new
people
plans.
switch, but we thought we were in
No,
a good
it's-
spot. We didn't see that coming.
See last year's.
Did they get-
There. Network Blue Select, there are 2 people. And Network Blue Select, LTD, 5 people,
Yeah,
so 7.
yeah.
Yippee.
I think this consolidation is what.
Yeah.
Next time you go at this, you
Yeah,
don't,
that's
you don't
definitely
give them
something
more
we can do.
options, you give them less options.
Right.
And, you know,
And
Yeah,
opt
I
out.
think we'll
2 or
look at a
3,
lot
and
more
that's
this
kinda,
time
you know,
than we did
that's what
last.
happened in the
And
corporate
then-
world.
yeah.
You know, I've been retired for 4 years now, but towards the end, they were taking these Cadillac plans and just saying, we're not offering it anymore. You have these other choices and, you know, you gotta decide.
Do the employees get to change it at open enrollment each year? Or are they locked in? I'm sure.
They can switch in between.
Like, you
Open
could
enrollment.
like bolster some education, basically.
Well, there's
Yeah.
not a
Next
lot
year.
of people in the Cadillac plan. This is the problem, right? Like, there's
Right.
only,
22.
Well, it's a Cadillac in terms of what it costs us, but it also costs them. So they've just been like, well, I don't want a Cadillac.
no, I know, but I'm saying the context of this
Well,
conversation.
we're
is
not gonna,
trying to,
we're not
like,
gonna
get
save $1
people
million.
on
No,
plans,
But,
like,
you know,
it's not- it's not gonna
incrementally,
be-
it's gonna
Right.
22 people, that's
Yeah, if you could get them.
a serious, you know.
You'd have to know where you're going though.
People are so,
Solid.
I don't know, I think
Before you do that.
well, I don't disagree with consolidating, but I do think that it is very personal for people, and like, I have an HMO and I love it, but I only have it because it's the only viable option for me. And for a lot of people, like, they're really anti-HMOs, and that's not for us to like
Yeah,
decide, that's their healthcare, you know what I mean? So like, we
Right,
could
right.
consolidate, but like, I don't know how much. Someone would have to run the numbers, but that's what we have cooking.
Right.
You know what I mean,
Right,
like,
right.
and people
They're
are
really
already
great
going on the
facts.
HMO is definitely
No,
a
they
deal,
seem
but
like-
you have to get like pre-ops and stuff, it's kind of
Well,
like.
well, and I think you also need to probably have like success stories, you know, that come off of it, because whenever I switched from a PPO to an HMO, the big concern was that my wife and I were going into childbearing years, and it was like, you really want to do this, and it's like, on the other side of it now, it's like you paid nothing out of pocket to have 3 kids.
I know, I did the same thing.
But it's like, I remember like in the run up to it, other parents were telling me like, no, it's okay, do it. This is why, it's better. But it's like, before that,
There's fear.
there was
Yeah.
huge fear.
Yeah,
It was like,
yeah.
I'd
I went
rather
through
take
same
the,
thing. I went
I'd
through
rather
the same
take
thing.
the thing that I know
I was
that is,
HMO.
than the unknown that could be nice, but it could be catastrophic.
I think there's a perception with the PPO, right, that you have more options,
Yeah.
more choice. But
Mhm.
if you're going to the same doctors, the same networks, you don't need the choice. You're gonna be with the same
Right.
providers that you trusted.
And the number, and everything's consolidated on the provider side too, so,
Unless you have some kind of circumstance where you
yeah.
have a lot of
Yeah.
service need. but-
All right, so we have some ideas to explore, okay?
Yep.
All right,
None of them sounded like they were gonna save a ton of money though.
no,
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 You know what I mean?
No.
It was around the edges.
right, no, this is not a 27, item anymore. All right, so can we move on to the next agenda item? And we have Megan here with us. Brent is here.
Do you wanna do that now, or do you wanna do? Okay.
Why don't we do the capital first?
Okay, that'd be nice, right,
Yeah.
I see, I see Rob is now, but why don't you text them, you can see it.
Yeah, why don't we do capital, because I think we don't need them for that, for
Alright,
the OPEB's discussion.
let me just put a moment. I'll put in Rob if you need him.
Megan, come on up, sit in the hot seat.
Yeah, I can, I'll put him in
And you
once
have-
he's, yeah.
Good evening.
Good evening. And Brent is here too, so. We asked Megan to come because for was it the municipal building stabilization fund? Brent was traveling and couldn't make that meeting, so thought it would be helpful we could cover them both and get taken care of tonight. So, which one do you want to start with? Maybe we'll start with the capital capital stabilization fund.
There we go.
Megan wrote us a nice letter that gave some highlights. Thank you. You want me to share? I have, want me to share some of the screen? Okay. Yeah. Okay, so get the OPEB here. So this is your letter.
Letter.
And capital. Would you like to, or would you like us to, we could just walk through some of the schedules? Is that better? Or would you like to go?
Yeah, I don't know how much you've reviewed, and I know you're gonna have a late night, so it's really up to you how much detail you'd like me to go through.
Why don't we just go through the schedules here?
Okay.
Yes.
What's interesting about this one is
What page?
20.
So this
First page.
is the one that looks, I can see if I can blow this up a little bit bigger, I guess.
Up to 17, I think. At the top.
Yeah, it should be the start of the.
17,950, yeah, upgraded setting software.
Yeah.
Yeah.
So this version is our working version. As you can see, we've got all kinds of different colors. We were keeping track of what somebody added in FY27, what moved years, changed priority. And then from the 2027 request, just to the right of the gray block, you can see the what we actually ended up with then to vote on. And that's, so any change between those two numbers is blue. So I think we cut about $150,000 between the beginning set of requests and what we ended up with. And we worked really hard with the department heads and Brittany and back and forth and to come up with what we thought. And we're like, oh, we could, defer something to next year, but it's just gonna make it more expensive and we're still gonna need it. So we just thought we could pick the items that we really felt were priorities. And like the big one this year is the sweeper for $330,000. It's a big chunk.
That's a
But
sweeper.
it is. They use it every day, and one of its redeeming qualities is it keeps our sewer system and the water flowing. So that's important that way.
It keeps the contaminants out of the sewer treatment plant.
Right, and all of those leaves and everything, which then costs a lot of money to
The treat
process and treat.
across,
So
yeah.
this is supposed to help.
And just the last time we bought one of these is, or how old is the one we have now?
I don't know
I
that.
don't want to be flip, but very old.
Okay.
What do they do with it when you get a new one? Trade them in.
Donate it to
Is that where
WGBH. I think they use it for scrap.
Oh.
Yeah. I don't think anyone would buy, I don't know, at a certain age, I don't think anyone other city or town would buy it off of us. So it's like scrap, I think, scrap material, yeah.
Okay.
Sorry.
We only have a pickup truck, I guess. That's public, these are all public works.
These is DPW.
And then a pavement management.
Yep.
That's the 185 we do every year.
Yep. Right. There was some conversation about should we reduce that number to make it something less, but that would also reduce our public street grade.
Yeah, our grade, yeah. What we've been able to maintain our street quality. And that's subsequent, or that is add on to our chapter 90, which we do every year.
And then the fire department has a few items.
Is pavement also sidewalks or is that?
No, it's not sidewalk, it's street.
Street.
Yeah.
If the fire department has, we're paying down a lease
Mhm.
and then a new vehicle for the department. And then under truck wash, which is actually gonna come from the revolving fund, and that takes the salt off the equipment. To prevent corrosion. Police department, we have a line cruiser. And again, this is something we're like, we could defer it, but we're hoping to replace one every year. So
Is that the program for police cars, one a year?
it is. And this is like the first one of the year that we had to buy 3. Because we've been putting it off so long, so. Right, this one has a few miles, but by the time we get to the one in 2028. Same model year.
So I don't see anything in 2028 and 9 or 30 for police cruise, is that?
If you look down the road.
Oh, I see, it's a separate line,
there's
okay.
different lines,
Got
Yeah,
it,
each.
got it. Oh, okay, yeah, okay, got it.
Yep.
Okay,
How many miles are on them when they? The curve.
Off the top of my head, I'm gonna say that the one we're gonna replace has maybe 65,000 miles on it,
How many?
65,000.
So why are we so far?
Oh,
Well, I think that in order to maintain them and keep them to the standard we need to, maintenance costs start to increase, and so you kind of have to, is the new car gonna be less money than the upkeep of the maintenance of that?
so what happens with the old car? It's got
They
65,000.
trade them in.
They trade
that
it in,
goes
so is that,
towards-
is that reflected in the price of the new one? Is it a lower price?
they either trade them in or they also maybe use them for projects like taking people back and forth to court.
Which doesn't go away, we still own them.
We don't sell it, we don't get rid of it though?
We do some we do
Trade-ins?
Yeah, yeah,
So what happens to that trade-in value?
it goes towards the cost of this.
So the 80.
It nets?
That's
So-
a net of a trade-in,
No.
85 grand?
That is without it, so if it would just reimburse the capital stabilization fund for, the money left over.
So trade-in gets put back into the
Yes,
capital.
yes, yeah.
Okay. We would just basically pay out less. so
Yes,
and then
exactly.
The difference, so we
Exactly.
pay out like 60,000
Yeah.
instead of 85, it would stay in the fund, okay?
Yeah.
Okay,
This is gonna be really unpopular question. Could pressure be exerted ever so gently and politely to ask the police department to keep their vehicles till 85,000 instead of 65,000?
Andrew,
The comment on those vehicles, have a huge amount of idling hours that are included in there, so they might have 65,000 miles, but the engine. They run the things all day long, they're not moving.
Yeah.
So,
Because the computers have to stay on, if they're going to something, they need the computers to be up and ready to go so that they can be communicating.
they function at 65,000, so it'd be the equivalent of like 110,000. They just run them all day long.
I think they come up with an electrification. See, here, instead of having it run off of a gas fire.
That's what I was thinking.
Someone should do
Plugging into
that.
something. No,
Maybe a hybrid is in our for the next version.
Yes.
well. Somehow.
Run the
Plug
extension
in
cord.
the computer.
It's like an office, right?
That's just the stupidest question of the day. School repairs don't fall into this budget, they're in a different budget. How do, we had this whole big thing about these expensive school repairs, is that in a different,
So that's the building. We'll get to
that'll be a
that.
school building, that's.
We're gonna talk about that after we get, now we're just talking
I don't
about.
want to jump the gun,
Yep, there are two funds, capital budget.
This is
fund.
non-building
And
and
then
then
the
the rest of
I'm
building.
one ahead of myself, all right,
Yeah.
I'll hold that question.
So the IT is the next one, I think, right?
Yes,
Yeah. Now, there's a separate schedule on this, 300,000.
yes, there is.
Let me see if I can find it.
2 pages later.
That's consistent
That's the one that
last
was
year.
that
Yes,
monthly.
we, when I first joined the capital budget committee many years ago, the
Is this
the
it?
IT
Yes.
budget went like this. It was like $75,000,
Now it's
and the next year
clouds,
was
yeah,
450, and it was just inconsistent, so we had kind of adopted this $300,000 steady state so that we could all plan and they could plan, and we didn't have these big fluctuations.
But you know, it's okay for them not to have a request of exactly 300 every year,
Oh.
right?
Yes,
Okay,
yes. So you can see on this page that we have overhead projector replacements and building control network switch replacements and that upgraded alarm system and access control alerting for the high school and exterior building cameras and replacements.
Yeah, keep going.
so it looks like the one up on the screen.
Uh-huh. So that's the $300,000 that you'll see under IT in that large.
Yep, it says
This is the one with your
300.
notes.
Sorry?
This is the right one with your notes?
Yes. Mhm.
I think we talked about this before, but the project list is in excess of 300. So I advertise that every year, so
Really IT.
maybe I made some.
Well, Brent knows the story behind us,
I could have swore I heard that.
right, Brent?
Well, I mean, well, somewhere I sent the one that goes back to the previous year.
Yeah, we have a history. That's in here too.
It's not in the packet.
Oh, it's not in the packet?
No.
I thought I actually put it in the
So the
packet.
focus changes from year to year as to what equipment they're replacing.
That's what
And as you all probably know, sometimes the procurement time between need and obtaining is more than a year. And so Owen, he made sure to clear everything so that you could see it from the year that it was charged, so to speak, not necessarily the year that got it. That's a little tricky. That was specifically about a year or two ago. Got a little better, I think.
So I can show everybody that history if you're interested in it. Brent did send it to me. I wanted it to be put in the packet, but
It was in the handout that we got electronic.
Yes,
We saw it. I mean, it was in.
oh, it was in what I sent you.
Yeah.
Yeah, okay.
Yeah, that was a good schedule.
Yeah,
Back-
it goes back, you know, yeah.
Yeah.
Yeah, okay, all right. So that, you know, I think, because we talked about this, you know, having the access to that detail, right? And looking at how they spent that money over a 5-year period. Brent, you know, got that detail and he provided it to me, so I shared it with everybody. So that's what that is. Any questions on that? The schedule?
This seems a little like not really IT. Is that a gripe? I mean, it's all not IT.
The safety and security.
I mean,
Piece
2/3
of
of the
it.
budget is not really IT. It's security cameras.
Yeah.
It's just a little weird.
Well, that's why it's in the capital budget.
Yeah.
As opposed to the operating budget.
I see.
Yeah, I mean, I think, so what goes in the warrant this year? I would suggest we use these categories
Yeah.
here,
Mhm.
okay?
The hardware.
So what you see up here?
Yeah, yeah.
Not school department IT, but these categories.
It's much clearer on
Because I think that does a better job of explaining what's.
Yeah, I had the same question when I first started.
Yeah.
Probably should be buying $300,000.
Yeah.
So, you know, it's really some hardware for support, hardware for curriculum, which are basically, I guess, I didn't realize these, but these overhead projectors are very expensive. They like,
Oh,
It's a
every
great-
year.
it's a-
150.
it's a great,
1080p.
it's a great business to be in, because once the light bulb goes, you can't replace the light bulb, you have to get a new
I
projector.
remember when
Jack Yancey
light
service.
boards first came out, unbelievable, and everybody in America was putting light boards up. Incredible expense.
Yeah. But the 150, the big item is security, and it's the for the high school of upgrade to the alarm system. And
They did a similar thing at the middle school and
Yeah.
have gotten a grant for it, I believe. And they tried several times to request this. And they
Yeah.
haven't been able to get a grant for it. And so they would like to move it forward here.
okay,
Yeah, I mean, it's a good thing. It's just, I would just
Well,
yeah,
label it as safety.
yeah. Okay, so we'll use these categories in the warrant. Okay. All right, so we gotta go back, I guess, now. So where are we? We are IT, okay. There's some other small amounts here, I guess.
Yes, these are the ones for the townhouse as a whole,
Yeah.
for other departments that aren't schools.
Okay. And then the DPW is,
These are things that came from the water and sewer department, and they're all self-funding.
so we usually have Mo come and talk to us. And when he comes, we'll have him cover the capital items. For the DPW. The water sewer ones.
Right. This is a dog that didn't bark. I know the library uses IT stuff. Do they just pay for that out of their own operating budget? Or do you know?
It would show up when they need it, it would show.
So, yeah, I mean, if they have capital items, it would on here, but they don't have any capital items for the next.
They're not asking,
years.
or either they're funding it from another source or, you know,
Intimidated by this.
they do get a lot of outside money.
Yeah. They have the trust and.
Yeah.
Yeah.
Operating budget covers their subscription services and that one.
Yeah.
Okay.
So the total of these from the capital stabilization you see here is the 1,131,000. And you can see that request, they've tried to schedule out 4 or 5 years, so the request is relatively stable. $1 million, it goes up 1,300,000 next year, but then it's about $1 million a year. But the balance and the roll forward analysis there, this is something we'll talk about later, but I think everybody knows there's going to be, when you have a budget situation like we have now, where we're asking departments to come back with a budget that's 1.2 or 1.3, whatever it's going to be, they're going to have to squeeze a lot of budgets, and the amount of free cash that we generate from the budget is going to go down, right? We know, we looked at the revenue side, and we know how tight that is. It's going to get really tight on the expenditure side. We're not going to have the turnbacks that we typically have.
Right. Yep.
So you can see, we've been putting 700,000, 800,000, 900,000 into this fund every year, and appropriating, around $1 million. But even if that drops down to 700, they were only able to get that creates a deficit in a couple of years. So it's going to have to relook at our scheduling, I guess, of capital items. But Well, it's
gonna end up being a warrant article. Another article, but that's separate.
Yeah, this has been a long-standing problem. It's the source of funding for this. Yeah.
When it gets to that point.
Right. All right. So any questions on capital, the capital stabilization fund? We're going to talk about.
Just to confirm, you said that the sewer is self-funded. I'm trying to remember when we talked to the sewer guy last year, but.
Yeah.
The water and sewer capital items comes out of their fund, but that's the enterprise fund.
Yep.
Water and sewer, and that is funded by fees, water and sewer fees. It's not funded by property tax.
Right, sure, but I recall them being in a bad spot last year,
Well, they
I guess we won't worry about that.
well, that's why, they went, they have a separate board. They have a separate board that looks at capital expenditures, what they forecasted out. They have a very complicated model with regard to how they set rates. But that one of the reasons why rates went up, 10, 11, what was it? 9% this past year is because of all the capital that they have to, it takes them years to build up the reserve. They have to start multiple years before they actually spend it because they don't have it in the reserve. So they have to increase rates to get the money to pay for some of the.
And they can increase rates as much as they want, just
Yeah, it's,
Yeah, that's
it's
nice.
it's a weird thing of municipal finance, I guess. It doesn't go to town meeting, so. I don't understand that, but I guess it's a safety issue. So.
Well, it takes them a long time to build up.
Yeah,
And then
yeah.
capital requirements are huge.
Yeah, yeah,
Yeah.
They're paying for
Right.
it out of retained earnings.
right, right,
So it's,
yeah.
Yeah.
So that's just the way it is. I don't know why, but that's just the way it is. We're not the only
Better not to
town.
ask money
Yeah.
from anybody else.
Yeah. And so should we go to building, municipal building? Okay,
Oh, and I'll just point out the next page is, right, is just the projects. You just,
but this is the approved project. So this. Okay, so this would, yeah, this would kind of be like what you'd see in the warrant, except for IT, we're gonna break out that 300, right?
we're gonna put in the.
Yeah. Yeah.
Yes.
You got it.
Yes, yeah.
Great, and I'm happy to say that we have the team from facilities
Yes, the
And-
team from.
and Rob are here.
we're gonna go through that last build up from 1,131,000 to 3.673.
Where's, oh, on the roll forward?
That schedule. You have 1,131,000.
I was wondering that too. It's not gonna be here in the warrant.
Oh, those are all from other sources. So those are from like the Water Sewer Enterprise Fund, the ALS Fund. And then they had a bond, the Water Sewer had a bond that they're using. They never borrowed and they're using it to pay for a project. That's what that 1.5 million is.
So the total capital really is 3.6 million.
Yeah, most of it is, 1.1 million is what we just went through. The other stuff we're gonna talk about when Mo comes in. Okay? Yeah, so we're gonna move on to municipal building, if that's okay. So,
Right, so we have a list of projects that total 1,509,937. We've got the title of the project, which is probably what will appear in the warrant. Do they all appear in the warrant? And then, just so you can see on the right-hand side are the potential projects. And this level of detail is one that Rob is comfortable with. That gives him the flexibility to projects as they come along and not be too constrained to deal with an emergency.
can you talk about sort of the, the delicate balance there, just so people understand that a little bit more?
Yep. In the past, and ideally, you'd see a request and it would say high school replace cafeteria flooring. And then the next, they'd all be that specific. But what's happened is that Rob encountered some of those projects that had that level of specificity. And when he got to the school, realized that maybe that wasn't the highest priority in his mind at that time. Like another room, the carpet was coming up. In the terms of flooring, all of a sudden that was the priority. And he didn't have the flexibility to address it. And as he's in his early years being with us, he feels like he needs a little bit of time to get that under his belt, get the projects addressed that are the urgent ones, and then going forward, maybe next year, if not the year after, to come back with really specific projects. I'll defer to Rob. Did I characterize that for you? It's muted.
Hey, good evening. Yeah, yeah, well done. So everything ties back with facilities to the Arrow Street report. And I'm sure everyone here has reviewed that. So what we're trying to do is allow facilities to stay a little more open-ended because the number of projects that are required to be done. Simply put, we'd prefer not to be handcuffed at this time because it's still very reactionary as I learn the systems and as I go through the buildings. And with it built this way, we're allowed to be more reactionary.
But I know you talked about this at the capital budget committee. I think, it is, where Rob's new and he's trying to get his arms around this, that's probably a practical approach. But long term, that's probably not probably not a good approach, right? We don't tend to have just open-ended kind of broad categories of projects. As he gets more knowledgeable about the buildings and what the priorities are, I think it's important to sort of work back in some specificity.
Yeah.
There's a balance. I understand that.
Yeah, we've also set up a plan to have a conversation after the end of the heating season in April and to review the projects that were approved for 2026 and see how they compare with what actually has been done.
Yeah.
And then also to do that a year later with these 2027 projects, just so that we're all comfortable that we're.
I mean, a lot of these categories just repeat building to building.
Right.
Was one thing I noticed, right? Which is what the Arrow Street report has that, right? So it's sort of, but one of the observations I made is that in the roll forward, which we'll get to, there's a consistent sometimes $400,000 of money that we're transferring back into the fund, for the last 4 or 5 years, which says either we are, and I know it was the case. We had his predecessor didn't do a very good job staying on top of things. Maybe didn't start projects, but we've had periods of time, 3-4 years go by where we approved the project. Maybe certain details weren't worked out and it didn't move forward. So they put the money back into the fund, which is the right thing to do. And Rob spent a lot of time going through and trying to clean that up. But I think one of the things that I think we should talk about as a committee is having a policy that after a certain number of years, that the assumption is that the money gets turned back into the fund for existing priorities. So if something if we've approved money and it hasn't been worked on 4 or 5 years, it needs to be, because we have if say maybe the policy is, I'm just making it up, we have to talk about it, but say if it's 3 years old and nothing's happened, the assumption is that it would get turned back we the facilities director says, no, I really need this. There's a reason why it didn't move forward, in which case we would take it to the capital budget committee and then they would approve it or not approve it, something like that. Because I think unless you have some discipline,
I think when you have those annual reviews now of budget versus actual the subsequent year, that might heighten that situation a lot.
Yeah.
I mean, if someone's coming back, we've done half the projects that they requested. I'm not gonna give that much money next year. I think that'll help.
Yeah, I mean, unfortunately, we went through a period of time with COVID and with the prior facilities director who wasn't on top of things.
Right.
That there was a big period of time where things weren't getting done. So
the allocations here have listed potential projects. Are those the priorities at this point, or those are examples of ways?
I think those are the priorities at this point, but I'll let Bob respond.
Yeah, so what you see there are the priorities at this point, and with the potential project description, that's what we hope to get done with those funds. Our goal is to not deviate from what we have on this sheet.
Gotcha. If there's a deviation, it's usually reactionary. Is that what typically?
Reactionary or failure of some sort. Let's say we had a piece of equipment that failed and flooded an area, and we have to replace the flooring in that spot. That would take priority over something else. So, like I said, it's somewhat reactionary still, but yes, the goal is to stay with what's on the right-hand column.
By nature of the beast, right? Managing facilities, we need a reactionary budget.
yeah, I mean, there's one here. I'm just looking at this district-wide request for roof replacement. There's 150,000, and in the comments it says annual request available for roof repairs, remainder to be put towards roof replacements. Could you just explain that, how that's going to work? Because I guess it's,
I had
you
the
got
same-
HVAC
exact
is
same
the
question.
same, yeah.
I can explain it. So what our hope is and our goal is to, I'll start with the HVAC, sort of cut and dry there. So we all know the local funds. What I call local funds is the budgets that the school department, the buildings, this town buildings operate on, operating budget, I guess you could say. They're extremely lean. So the only way we can accomplish any real projects is through this process, correct? So what I'm saying is when I look for $150,000 annually for HVAC equipment, equipment and installation, because the reality is the equipment that we have that's existing on most of our buildings is 30 plus years old, and a single piece of equipment costs 280,000. So we're really not getting anywhere going to capital asking for 50. You know what I'm saying? So we need to build, much like the 185 you do with the DPW for paving. We need to build that fund, build funds allocated strictly for that those type of equipment and installation. So when a major piece of equipment comes up, we can get it done. But with that being said, the goal is to continue to spend that 150 down, getting smaller projects done, projects that we can handle within this budget. And same goes for the roofs. We all know the age of the roofs. You read the Arrow Street report. They all need to be replaced. That's not going to happen. So we're going to need funds to operate, literally operate and make major repairs, much like we did at Memorial. We've done 2 complete overlays, not Memorial, at Blake. We've done 2 complete overlays at Blake. If we didn't have this account with those funds in it, we wouldn't be able to do that. We'd have to close the school. So this is a way to, in essence, keep patching until we come up with the process where we can do full roof replacements.
Is it a fund that's being built or would
Well,
that just then transfer to
Well, that was,
like?
that was my
Like-
question. It's almost like they're building a fund within a fund.
Right. Which I, yeah.
Somewhere else to do it.
Right.
Yeah.
You get a big ticket, right? You're ready to.
I mean, ideally, you'd get to a point like what you do in the capital stabilization fund, where you get the true cost of something.
Right.
It gets scheduled. You're gonna do Havoc on Wheelock in year 5 or year 4.
Yes.
It's a 280,000, you know,
Mhm.
so that you don't need to do what he's doing here. You know what I'm saying?
Yeah.
Or you could at least. keep it
So it's on a facility side, it's simply for myself, it would be very simple to come to this committee and say, you know, we need $700,000, a $250,000 job, $250,000 job, another $200,000 job. Put those jobs out in the street, get 3 or 4 pieces of equipment done. But the reality is the state that we're in now, we need to do it this way. And that 150, and when we're talking about HVAC, that's a small piece of, read the report, read the Arrow Street report. That's small dollars for what the requirement is that we need right now.
Hey Rob, this is Emily. I guess what I'm still not understanding how it will work, and maybe it's because it wasn't happening in my time on this committee, but like, I remember watching the select board meeting when they went over the Arrow Street report and they talked about buildings and envelopes, and then that Mike Quinlan guy was there talking about how like the MSBA might be able to help us with the roof replacements on some of the schools. Like, who is the driver of that? Like, who's the driver of these major capital projects? 'Cause I think a lot of us are just wondering, like, we have the capital stabilization fund, the municipal stabilization fund, and like what we're talking about, like much lower dollars. And we all understand that we need debt exclusion overrides to do big projects, but like, who is the driver? Because like someone's got to get behind the bus. You know what I mean? Like,
Well, I can speak to this. I've been here a year. One of the first things the superintendent told me to do is he said, figure out how to get us roofs. I can't stand, we got to figure out these leaks. Figure out an avenue. He said, any avenue, figure out an avenue. I've been working with Michael and the MSBA to get funding through that. So the school department's well aware and they're doing everything they can to get us funding. But the reality is that's a town decision. I know we're coming up against a lot of things with Dale Street, but that's a town decision. It's not a local decision. But the driver is the superintendent with the schools. And like I said, and actually when I was getting hired, when I was going through the hiring process, we talked about roofs. He talked about how it's a priority of his. And you know, that's why we've had a couple of overlays. That's why we went out on the street and had it repaired down at Memorial. And that's why we're looking for these funds to keep that process going until the town makes a decision on how they want to fund complete replacements. Now, we're working on a couple of projects right now at one of the schools where we may be able to get solar put on the roof to either eliminate or reduce the cost to the town for a new roof. We're still working on that, so I don't want to talk about that too much because I don't want to get anyone's hopes up, but we're working on every avenue we can to get funds to get this done.
Well, thank you so much. We're so glad that you're here. I think. Just saying, but like, how do you, like, you were a facilities manager elsewhere, right? Like, I guess it's just what the elephant in the room always, that like, we need too much money and no one wants to ask for it. Like, right? I mean, like, isn't that what?
No, I mean, I understand what you're saying, but I kind of disagree because I think the first step was to get that Arrow Street report done. So now the powers to be see what reality is. So now, of course, we're in a budget cycle that's tough, but that's the juggling act. I know we've all been around doing this, so that's the juggling act. So everyone's well aware of what's required. My job is to use the funds that are allotted to facilities in the best way possible, and to fight for more funding, right? But I understand the big picture. And I think the town is starting to understand the big picture after receiving this report. I mean, they've only had it for a couple of months, so you know, I'm sure there's people working on this.
Well, then why are we going through a budget cycle without a request for money to fix it?
I think what we're doing is we're going through this budget cycle right now with a request for money to keep with the ongoing repairs until the town decides on how they want to go about funding these projects. I mean, the numbers are in that book.
The reality is that I think there's a lot coming at the town right now, right? There's our budget, our operating budget, there's the school, and there's all these capital items. So I think there's a sensitivity that, I mean, ideally, if we were Wellesley, we'd do it all this year, right? We're not. We have problems. We can't spend money without really taxing residents, you know, significantly. We can't do all this at once.
You'd have to have a significant debt override.
We can't do it all at once.
Capital thing.
And that's the problem.
You've got an operating override
somehow
potentially that we're facing.
We have to phase it.
I know.
And then we've got Dale Street, which is the huge elephant.
Yeah, but on the previous discussion, we had a 5-year capital plan of all the different things we want to buy.
Right.
But on this page, we have a 1-year thing and it doesn't address the things we need to go do.
Right, we have an Arrow Street plan, which is a 20-year plan that kind of does priority 1, 2, 3, 4, and so Rob's challenge, I think, over the next year in the select board is to take that report and create what we have for capital stabilization, like put projects in particular fiscal years.
Yeah,
you know what I'm saying?
Yeah, because the way I read that. Rob, the way I read the Arrow Street thing was about $2.5 million per roof. So, you know, you're not really ever going to get there with 150,000.
No.
You know what I mean?
No.
Yeah.
No, I agree, but I caution you that $2.5 million is really, that's a low number.
I was gonna say, I mean, like, but
numbers are always low. No one ever says they're too high.
But at some point, people are gonna need to see like, oh yeah, by the way, I need $12 million for this.
Yeah.
And unless you put it front and center.
Yeah, I don't want to, yeah, that's.
I don't want to be sitting here 5 years from now going like, well, we
That's
haven't
the
talked
thing.
about it yet. It's like, well, nobody's brought it up.
That's the thing, when it comes back to what the warrant committee is supposed to do, is we're rolling into what may be an override vote on healthcare costs, which nobody can control. And we're not outlining that their roofs are gonna fall down. And that's why the FAP Center is totally not usable and is been condemned by the state because we didn't repair it, is like a total misuse of planning. And that's nobody, I mean, I'm not pointing fingers, but like you have to repair things and fix them or they're gonna get condemned by the state.
And we understand, like, your capital budget committee doesn't, you don't consider it your, in your charter to solve these big, you meet with a $1 million budget, you can't possibly
No, of
solve.
course not.
No.
it.
I
So,
think what Pete, me and Pete maybe are trying to say here is that like. Someone needs to own this, cause it just keeps saying like, well, it's the town, it's the superintendent, it's this person, but it's like. I mean, we all know what's going on, we know that we need a lot more money and we're worried that the town's not gonna pass it,
Yeah.
all that stuff, but like. I remember Scott McDermott telling me one time, like, that the only way you get something done is if like you are. Like really passionate about it, and like that's how he got the fields, right, of the town, right, these beautiful fields. But like, who's the roof person? Like, let's, you know what I mean? Like, I just,
Yeah.
I don't know, just think of like the last couple of years.
well, okay, so,
You know what I
I
mean? Like, and I
think
know that's not for us to solve, but
Yeah,
I think someone needs to, like,
no, I,
Christine or the select board needs to be like, this needs its own committee.
yeah,
And it needs its own like person to be like, no, this is gonna happen because otherwise it's gonna cost us way more. And
right. No, I don't
I'm all
disagree.
about the communication.
I think we're all in agreement, right? I don't think there's disagreement on that.
Totally.
But we're not gonna solve that now, right? We're not gonna take up that charge. It's gotta be the select board, the school committee or school department and the facilities department. So they, I do think that, when you hire a consultant to do a report like they did, there's a bit of,
Onus.
there's a bit of self-serving, if you're asking a consultant to put a report together on capital needs, they're gonna find every single capital need and put it in the report and say it's urgent and all that stuff. I'm not saying it's not urgent, but that, that message clearly came through in the report, which was probably, I'm sure they wanted that message to get through, right? That's the first step in creating energy and initiative but I don't want to scare people to think that the roofs are gonna fall down. Okay.
We don't know that, right?
I think the question then is, what's the response to the?
Yes, and I think that
Who's
the
doing
select board had a meeting, they invited our street in, and I don't know if you were there, but the permanent plan and building committee was there and they talked about it. So I forget what the to-do was coming out of that, but I assume they're gonna have a follow-up meeting.
That was July
So-
1st.
But I just don't want to take up time in this meeting
Fair enough.
anymore
Fair enough.
about on this topic, if
Okay.
that's okay. Because I think I know you're all frustrated, but you're frustrated at the wrong people that are here. So.
No, it's the same old thing, right? That's.
Yeah.
In the room is all the stuff.
Frustrated with the person who isn't here.
Yes,
Right.
In charge of it.
yes.
How do we formally ask? Or like, need some understanding of. Yeah.
I mean, go to a select board meeting
Okay, yeah.
and voice your
That's
concern.
true.
Yeah. Okay, so this list, we haven't
Yes.
gotten too far on it. We're through this, the through list. Okay, so is there any questions on this? I think the big items are, well, there's a lot of like small items basically that make it up, but the big items are the district-wide paving, the roof replacement and the HVAC equipment.
I think it'd be helpful to understand, maybe the funding within the fund, but. To your point, Steve, kind of policy around how long that sits out there and
Yeah,
when
yeah.
it turns back.
I think this is kind of transition year. This is a transition
Totally
year.
get it,
Yeah,
and
yeah.
I applaud, is it Rob, for the job he's trying to do, so.
Yeah,
I
totally.
get it.
Yeah.
Yeah,
I just had one quick question, and it's a small dollar thing. But why is there a tri-county assessment that appears?
oh, that's a good question. That was on my list of things to talk about. So you remember
It's an educational cost. That's not-
Tri-County built a new school.
Oh, we had an article about this.
And this is the first year we get a capital assessment.
Yeah, I forgot.
And it's being put into the municipal building stabilization fund.
Yes.
So, but one of the things on my list, if maybe at our first January meeting, we'd like someone from Tri-County to come here and explain to us how they came up with both this capital assessment and the other assessment for the 15.
Our agreement.
Yeah. It's getting to be a big number now, so, yeah.
That number might go up as well, the number in here.
It might
Like 1,000.
It is based on the number of kids that are enrolled, and our enrollment has increased, so.
Yeah, so we need,
Christine has a meeting with them on, I believe, the 19th of December.
okay,
And so we'll get a more formal number at that point, and then we can.
have them come back, or they can zoom in, you know, okay. Okay, anything else on the municipal building? Any other questions? Okay.
Oh, I had a
They
question.
do have an emergency repair. Oh, yeah, there is actually, go ahead, Pete, I have a question after you. Go ahead.
Last year, there was a warrant on the replacement of the FAP Center. They had the trailers at the Hinkley Pond. That was a 1-year warrant. And whatever happened to that? Did that come into be it really isn't 1 year? It's a second year, or it's in here or it's not in here? Where did that go?
So that is, it's a little bit on hold, because what happened is the bids came in much higher than what the warrant article was for.
Okay.
And so right now they are still leasing their space at the UCC. And
So it never happened.
They never spent the money.
so
Okay.
that money is still, but that the money didn't go away. It wasn't.
I was the only one that voted against that last year.
The money is still being held in that.
I was present that.
And it could be, once the commission is having discussions on what kind of the next steps are with that.
Mhm.
And so it could be at a future town meeting, we reallocate that to something else, whatever that future project is going to be. But they are having discussions at their meetings about what is next steps for them.
Okay, and my question was on the Green Communities, $100,000. It says annual request to be put towards green community projects. So this is another 100,000 that every year we've been putting in the budget. Somehow I didn't see this last year, so just remind me of what this is about and why we have this. And who approves these projects?
Rob, are you there?
So, yeah, I can speak to that. I can speak to, we used the money last year. Don't hold me to the number, but we replaced a number of rooftop units at the library, RTUs at the library with heat pumps and so forth, more electrical for green communities. We were slated to have the chiller replaced at Town Hall prior to this heating cooling season, but we lost the funding with the state. So we prioritize jobs that we feel will get green community support, and then we use those funds to backfill whatever we can't get through grants and so forth. That's the town's allocation to those projects.
So said another way, if a project costs $300,000 and you are able to secure funding of $200,000 from green communities, the town has to come up with the difference of $100,000, and that's what this is for.
Correct.
Now, what happens to that project at the town that you didn't get if you don't get the funding from green communities, the project doesn't happen, in which case, what about the $100,000 we had last year? Does that?
So if you look at line 31, says chiller replacement. we pulled it. So we dropped it to the bottom. I think it's
Be town hall.
Town hall.
We don't have the line items.
Line item 4 on column 7, row 7.
Oh, I'm looking at maybe at a different sheet.
Yeah, group 7. It's the bottom line for townhouse.
Oh, chiller replacement. Okay.
So we cut, but we put in a cut column, but long and short, it drops to the bottom. And that's what's funding this 100 here for green communities.
I'm sorry, say that again? I'm not sure I follow that.
We didn't spend those funds.
In 27, it came out of the budget.
So, yeah, sorry to cut in. So I think the confusion might be this wording where it says annual request. This
Yeah.
would be the first request for a dedicated green communities fund.
Okay.
And so the part of the issue
So I
is
didn't miss it last year. Okay.
cycle for green communities does not align with our budget cycle. So we don't want to, we could miss out on some potentially great projects. So we would like to avoid that happening.
Okay.
So
Okay.
last year when we were talking about this, I think we decided on the projects in March or April. And in order to make the chiller project work, we had to put in a significant more money than we had allocated or we had around.
Yeah.
Setting it aside like this would allow us to have it in these off. At that time, it's too late to ask for it.
Mm-hmm.
So this would allow it kind of to be set aside and available to be asked for.
Maybe we could come up with a different, more descriptive term than just green community. That kind of confusing.
Okay.
Sounds like it's a state effort that you're doing matching for.
It is the Green Communities Grant. That's what it's called. Yeah.
Okay, so maybe say green communities grant.
Through grants.
Yeah,
Or
something like matching funds.
matching green community funds, or
Yeah.
something like that. Yeah. Okay, sorry, I was just. Okay, so then the roll forward here gets us to about the 300, but this is where, remember I mentioned earlier, we have this line appropriations into the fund. It was 300,000, 477, 147, 261, 234, 284. That's what I was talking about.
Those are the projects not done.
Unused.
Yeah,
It's like you,
yeah.
Yeah.
And there's
Can I just
more
say
out
something?
there.
Can I just
that
say
haven't
something real
closed.
it's like
quick?
free cash for capital.
Yeah, but there's more out there that they haven't closed, that they're still doing analysis of.
Right.
So, yeah, go ahead, Rob.
So some of those funds that have returned are completed projects that were, for lack of the correct term, over budgeted. So,
Yeah.
or we got favorable bids. So a large majority of that number is like the tennis courts, for example, they came in under the bids came in favorable. We didn't have many change orders, so we were able to give back money or turn it back, I guess you should say.
Yeah. And
Great job
Which
on the
is
tennis court.
Yeah.
everybody likes the tennis court, Rob. All right. Anything else on the municipal building? All right, the Medfield Outreach Project. That was in the list.
Yep, it's in the list. It's in the list, but
Right.
I just thought I would point it out because it's a big project.
Yeah,
And so I wanted to just summarize how it all came together so you could see. It's the third year we've tried to do it. Last year we added another $100,000, but bids came in the late spring. They were exceeded the budget. So this is an amount that we feel, or that Ben feels comfortable that we'll be able to get our bids back and complete the project within this budget.
238,000.
238.
and this is it's to take some of the space where Medfield TV was, or,
Where they were.
and to
At the high school.
build some offices, individual offices.
I've been in there several times doing their budgeting the past couple of years. They really don't have much private space at all in there. They have fun to see this finally coming together for them.
What they need is the confidential space, a lot of what they do. And a lot of their offices is just a big giant office and they take turns going into the smaller space. So
That's great.
Yeah, stuff when you have multiple kids in there,
Yeah,
they've got a lot of needs. more than.
And I'm sure the full plan set and specs talks about how it's more than just adding these 4 walls.
Yeah, it looks like it's just.
Well, I know that there's sprinklers and HVAC that have to move, and then anything else?
Yeah, so right now there's no ceiling. So yes, exactly. Lights, sprinkler,
So, yeah.
the
Well, there's a
HVAC.
roof, there's a
Oh,
roof.
there's a roof, but the roof might be leaking.
Well,
Industrial in there.
So. Okay, that makes sense.
And then it's like,
it's like, yeah,
The old studio.
yeah,
where the
Okay.
Medfield studio used to, you know, where that used to be, it's attached to the high school.
yeah, it's attached, but
It's across from
It-
that, like.
It's kind of in its own little area.
You know that walkthrough where like Rose Bay is gonna be built? Like,
Yeah, you know where that,
Yeah,
so if you're driving, if you go through the back
like if you were
entrance,
driving
go through
between
the back
theater
entrance and
and
you go around that big corner, just as you go around that corner, it's right there. It's right, as you look up to the left, it's right there.
right, the playground,
Yeah.
and then the
Your
street.
little playground is
Medfield
on,
TV,
and Rose, the entrance to Rose Bay is there.
Medfield Outreach. Yeah, formerly Medfield. TV.
Yes, yeah.
Yeah.
It's like back door of the cafeteria dumpster and then their nice entrance. Externally, yeah, it needs.
Okay. Anything, any questions on this then? Thank you for giving us that.
That's good.
detail.
Thank you. Rob, thank you.
Rob,
Thank
Yep,
you.
thanks, guys. I appreciate it.
Rob.
And,
Thank you.
and Ben.
Yeah,
Thanks,
So
everyone.
you've completed your work. You voted on all this, right?
we have,
Thank you. Okay,
yep,
excellent. Thank
Okay.
you.
good luck.
Okay, yeah, thanks.
Thank you.
You want to balance the budget for us?
Yeah.
Okay, so, next item is to talk about OPEB. So, let's talk about OPEB. OPEB is other post-employment benefits. It stands for, that's what it stands for. It's basically, essentially, you know, it's health insurance for retirees. So when we hire somebody, so like a teacher, these two employees here, we make a promise to them that if they work for so many years, was it 10 years or something like that, they get a benefit when they retire. And the benefit is that the town pays 50% of their health insurance for till they die. And so obviously you can imagine we have like over 300 active employees and another 300 retirees. So the promise we make to active employees, that's a liability that we don't pay until they retire. And then the people who are retired, you know, there's a liability related to that. So what the accounting standards make towns and municipalities do is hire an actuary and to calculate using a lot of different assumptions what that liability would be. And that's why we have this report. There's a separate committee, the OPEB Trust Fund Committee that so let me back up. So that's the liability. It's our largest liability. It's like $42 million. We, back in, I think, 2016, 17, or 18, I'm not sure exactly the date, we created a, because this was a liability that all the towns were dealing with. And so they allowed towns to create a trust fund, the OPEB Trust Fund. And in that fund, we have made contributions, you know, over the years. Excuse me. And there's about $9 million in it now. So that the idea is that that's invested and we'll continue to make contributions, and eventually some year 2050, whatever, I'll be dead, but it'll be big enough to pay the liability.
So this is,
We're creating an endowment.
Yes, yeah, yeah,
This
yeah.
is
Through the
hard
trust
for
fund.
my
so this
brain to
is Joe and
understand.
Ashley's problem.
Yeah, yeah.
But
So-
like, this isn't like a liability like that we owe. This is a future liability.
No, according to accounting standards, this is a liability that is owed by the town.
Because we made the promise.
You made a we made a promise to these people when we
Well,
hired them.
Yeah, but there's no bill for it.
Well, that's the point of accrual accounting. You accrue,
That's
you
what I think I
accrue,
need to
you accrue
understand.
liabilities when they're incurred, not when you get a bill. So, that's the whole point of accrual accounting. So,
If we were cash net, that it would be whenever it came in or went out, that's when we would take it.
No, I know, but I emailed Steve about this, and maybe I'm the only one who like has trouble understanding this, but like we pay health insurance for retirees right now.
so
We pay that out of the operating budget.
right.
So to like separate those two is was a little hard for me, but that's because I don't have an accounting major, I think. That,
Yeah, it's
you know what I mean? Like,
It's kind of they call it pay as you go, which is essentially like a cash basis. Basically, and what comes out of the operating budget today is the current cost of the health insurance for everybody that's working and the current retirees. What this captures is the future cost
right.
of health insurance. Because it's considered a liability. It's like pension, like the unfunded pension
Yeah,
liability.
yeah.
That's not funded,
But
but
that
we have,
has an end date because we don't do pensions anymore. Like, health insurance is never going away. So when we say like, we're gonna eventually catch up with this, like, that doesn't make sense to me because like, we will always have this liability, correct? You know what I mean?
no. I mean, some towns have fully funded this. Some towns have like Wellesley went out and borrowed money.
No, Wellesley has, I looked on the website. Wellesley has a huge, like, well, sorry, Steve, I know you know me better than me, but I did go to the OPEB website and was like looking by town and looking what the liability was, and it's like. Anyway, go on. Sorry.
Yeah.
Mhm.
Well, I know they went out and borrowed money to put it in their trust fund. So it got invested. And there are other towns that haven't done anything with it. They just left it at zero.
I know you don't want to spend a lot of time on Westby Wells, the finances, but with the money that they borrowed to put into the OPEB trust, how are they paying that back? Anybody that know, and
I don't know. I don't know.
No.
I haven't studied. I don't know the answer to that, but
I went to Wellesley
Then
because
I
I
opened
was
my
like,
mouth.
oh, Wellesley is a rich town, let's see what they've got going on, and I went on there. And they're like, oh, it does say includes MLP, their total OPEB liability is 132 million.
yeah, but what is it net of their trust? What's the net number?
But it's still 57.
57 million.
Yeah.
Okay, well, maybe they
Anyway.
didn't borrow enough. I don't know. But at any rate,
It is what it is.
yeah. So the point of this is though that there's a bunch of assumptions that go into what the liability amount is. And then there's what we put into this trust. And so the net is 32 million, right? The important information is what's the funded ratio, right? And that is, we are 22% funded. Okay,
32,
what's that?
of 32 million.
42.
42 million, so 9 million out of 42, I guess that gets you to the 22% number. A town like Holliston is 59%. So we should call Nick up and find out how they did this.
Yeah, but you should see their roofs.
Yeah.
Well, maybe we can sell some of those police cruisers.
I mean, I mean, we could be at 42 like Foxborough if we had a Gillette Stadium.
Right.
Like, not everybody has a Gillette Stadium.
Yeah, we got real.
Dang, Quincy's at 0.4%.
But then you got a town like Bellingham that practically hasn't done anything. right? They've, so, but you can see we're paying, the benefit payments by the actuary that are calculated at 1.8, and our annual service cost is $991. So we've got a long ways to go. I do think at some point this, Gus is on this committee too, and he's of the view, I agree with him, that when we get closer to like 70 or 80%, maybe we don't need to be putting in money like at the level that we're doing. And we could back off, but we're so far away from that, and healthcare costs, the assumptions that he's using here for long-term increases in healthcare are a lot less than what we're experiencing.
If we were estimating 15%, these numbers change.
Yeah.
This slide is because someone asked, why don't we just not fund it this year? At the last meeting we had, someone said, hey, why don't we cut the funding? What would happen? And what we're trying to say here is it's actually only 22% funded, and this is a healthy thing to do.
And the other,
How much are we putting in per year? Like $1 million?
no, we're, it's about 6 and 26, 27, I think it's like 600,000.
Oh, yeah.
Now, the other reason why, you'll notice there's an article here, which is kind of fine print. It's hard to see, but in your packet that you got, there's an article that by the way, the principal of this Odyssey, who presented this report, he wrote this blog article, and he's very good. He pointed out the impact that rating agencies are now weighing in on. They're looking at pension obligations and OPEB obligations, liabilities. And the towns who aren't doing anything are not getting good ratings. Okay, so this impacts our bond rating, which is another reason to continue to fund it. One movement up or down in our bond rating could save like 50 basis points on a bond offering. We're about to do the largest bond offering the town's ever done with the new school. So that could be, on a $75 million bond, that could be $6 million difference between one rating and another rating. So
I hear you, but just to play devil advocate, like if we put a increment less, like I'm not saying a number, but again, just not to not fund it, but to fund it a little bit less for a few years, like would that really make that big of a difference in the bond assessment? Because like if I'm looking by town, I mean, Westwood is 20%. They just did a big school, and I don't know, like I'm just playing devil's advocate, like how we can.
Well, could you share that with the committee, what you're looking at?
Okay.
Yeah.
I don't know how to do that.
We can talk about it next meeting.
Okay, all right.
But I think that Westwood also has more employees than us.
I know it's not a good
comparison.
Yeah. I'm just trying to.
But so I think there's other reasons why you could technically, we did it for a couple. One of the things we'll look at if we get to it is the free cash and how we used it in prior years. There was a year when we didn't fund OPEB. We put nothing in. So, and I think if you look back at one of the bond rating agencies reports right after that, they might have noted that in the report. So, their job is to look at the financial management of the town, how you're using reserves, how you're managing your budgets, what the debt is of the town, and come up with a rating, because investors want to know if they're going to buy the bonds, is this a good investment, right? So they're going to look at all these things.
I get it.
Yeah.
Do we have an idea of the range they're looking for? Like somebody feels like 60 or 70% is good funding rate, but.
Oh, I don't think there's too many. Well, just put it in perspective. At 22%, we are in the 70th percentile.
Okay.
So we're not doing bad.
So we good. Yeah.
But But so quite theoretically.
Which,
feel
I don't
bad
know,
about someone that might-
other towns are doing terrible,
Yeah.
or we're just not doing as bad, but it's, you know, so it's all relative, right? So
Yeah, I'm just like, again.
we're not, you don't want to be in the 90th percentile, right? But,
Right.
so I mean, you could not put as much in.
That's what
I
I'm
don't-
saying.
I don't-
I never said zero.
Right,
Yeah.
like do.
I mean, there was a year when we didn't increase it by 5%. But that saves you like $20,000-$30,000 of free, and this is coming out of free cash, remember, this is not in our operating budget. The funding of OPEB is funded from free cash. It's not coming out of the operating budget. So I'm not sure why
Right,
you
but,
want to know.
well, but we're gonna have less free cash because we increased the excise estimate. Like,
Yeah.
I'm just trying to like.
In the future, it could be a conversation.
Like, I just wanna be like, cause you know me, I'm very like, honest and transparent, but like. At our last meeting with the school committee, they basically are trying to say like, how can we increase our estimate of revenue, right? And I know that that didn't land that well with us, cause it's like, we're trying to help you, like, we did increase the excise tax a little bit, we did increase the. I don't know if it was state aid or whatever we did, and I know that's the next thing on the agenda item, but I'm just saying that like, I thought about it a lot afterwards, and I thought about how like. I don't know that they're doing it to try to squeeze the budget as much as maybe they're just trying to like. Make the potential failure of an override less painful, because at the end of the day, like, we're gonna go into town meeting with. Hopefully 2 budgets, right? One with. What we are estimating is our revenue, which was 1.2% or whatever, right? And then an override. Okay, if we don't want to fire a bunch of people, if we can. Prudently make that number higher, and I'm not trying to side with anybody, I'm just trying to look at it from a different lens, because I did think about it like that way, that would maybe make them have to fire 5 less people.
Yeah, can we just put a pin in that for now?
Okay.
Because I think we'll get to that conversation at another agenda item later on, okay? So any questions on OPEB? I mean, I think that
So it can get complicated.
it's,
Yeah.
you know, it's a complicated calculation. It, you know, I thought I'd share it with you. I mean, I do think that I think that the current policy, remember when we thought the plan was when the pension fund got fully funded in 2029, a year ago, we were thinking that if that happened, we would have $3 million that would come out of the operating budget, and we could put a big contribution to OPEB at that point every year. We could move this from free cash into the operating budget. Well, a year later, a lot of things have changed, like healthcare and budget challenges, and the fact that the full funding of pension fund has been pushed out to 2036. So that's not going to happen for a long time. This is our funding ratio kind of stayed the same. That's the one thing I always look at on this, is if it starts to slip, then I think not putting money in or skipping a year would be problematic. But if it keeps going up, which is what you want, the whole idea of this is that you want that funding ratio to go up every year, either through good investment, higher contributions, right, or managed healthcare costs. But as healthcare costs keep going up, I don't see the funding ratio going up dramatically. I think it's going to be a challenge.
And how often do they reanalyze the total number? The total
Every 2
liability?
years, they do a full actuarial evaluation.
So
The next one's in fact.
I think that was gonna lead to my next question. My question was on like the projected cash flows slide. It looks like maybe a break even to where our fiduciary net position and our total liability is probably somewhere around 2052
Yeah,
currently.
yeah,
Right.
yeah,
Right.
yeah. 2052 is when it's supposed to be fully funded, I guess.
So, but then also, like you were just saying, there's like 3 inputs. It's like either
That could change.
return
next
on
time they do this.
investment,
Right.
the amount we
Well.
contribute, and or health costs.
Yeah, those are the big ones, yeah.
But
There are other ones.
But
There
you
are
flip those toggles, those are the big ones.
Yeah.
So.
Yeah.
But I guess maybe this current projection here is assuming we don't make any changes.
Right.
and just
That projection assumes we continue to increase the contribution by 5%
What we
every
did.
year. Yeah, that's our policy right now.
So to the earlier point, it would be like if we were to, it's like the compounding interest. Then if we were to cut back a little bit, we're gonna extend out the fully funded.
Yeah, the fully funded date will be 2060 or 2070. I mean, you could say, I don't care, but I mean, the reality is we are incurring this liability now. We hire these people and make these promises to them. And
Is
then,
there anybody at
I
the
get
state
that.
level?
Huh?
Is there anybody I mean, the state monitors what we're doing vis-a-vis the pension. Is there anybody at the state level who monitors what we do vis-a-vis OPEB?
they collect all this information, okay? We send the reports into them, all these reports that it gets done. They produce some consolidated reports, but there is no requirement like there is with pensions to have this fully funded by a particular date right now.
Right.
My personal view is once all the pension stuff gets fully funded, they're gonna come out with a mandate to have this fully funded by a certain date. So after 2040, they'll probably come out and say, you have to fully fund this.
That's a good answer. Thanks.
So,
With the reassessment in our policy at 5% more each year, isn't it quite possible that our funding ratio will go down? From 22?
theoretically, you would think if healthcare costs continue to go up at 15, 18% a year. I mean, we had,
Right,
it seems like it went up slightly, so that, but next time we look at this, that'll be the big thing that will.
And whatever that sweet spot is, the bottom tax, right?
Yeah.
Because you could, especially if we have shrinking free cash, we could try to play with that a bit and say, maybe we don't do 5%, maybe we do 3% or something. So
Yeah.
along the contribution possibility.
Steve,
I know.
When you mentioned 70%, we're in the 70th percentile. That's this schedule here that looks at your funding ratio, and we're at 22.3%.
Yeah.
So we're right between the 60 and 70.
Yeah, that's the schedule here, right? Yep.
Yeah. So even at 22%, we get a C.
Right. Yeah.
So we're grading on the plus here.
Yeah.
But you understand the power of compounding, right? The more money you put into this, the faster it will grow. And over the long term, you save.
Although if health insurance costs keep going up 18%.
We won't have the free cash. I understand. Okay, any more conversation on OPEB? All right. So let's move on then to our free cash discussion. Okay, so yeah. Free cash. Here we go. Okay, so there's this schedule you can see up on the screen. It's a summary schedule of certified free cash. It has a date it was certified, and then it has free cash expenditures, and then another column that says free cash used to reduce the tax rate. That's basically using free cash to balance the operating budget. And then it has an ending unspent free cash balance, okay, which was the reserve. So Yvonne and Andrew worked on this and put this together. It goes back 10 years because I think it was important for people to see what was happening, the history of our bad habits, I call bad habits, in the past. In 2016, 17, and 18, we were using very little free cash for pretty much the only thing we were using it for in those years was for OPEB and maybe a little into a stabilization fund, but most of it was used for OPEB. Okay, because we didn't have a lot of free cash, because we used a lot of free cash to balance the budget. We used 628,000 in 16, 720, 1,092, a million for. Now, in 2018, we had an override. It obviously wasn't enough because we kept using free cash to balance the operating budget in 2019, 20, 21, 22. We instituted our new policy of not using free cash to balance the operating budget, and we haven't used it since, okay? But if you look at the things that we have used free cash for, so there's a flip. You can see there's an obvious flip here between, you know, heavily weighted to using free cash to balance the budget, to not using it at all, to not having a lot of free cash, to having a lot of free cash, right? That's kind of what happens, right? Over these 10 years. And so this is what we used it on last year. Everyone's familiar with this, right? We put 850 into capital stabilization, 190 for the tennis courts. OPEB, we put some money into stabilization. We had the final payment for elementary school feasibility study and the tax school mitigation fund. And you'll see a similar trend in 2005, right? 2005, we had special education funds, allocation, mitigation fund, capital stabilization, school feasibility, and OPEB. Those are all the big items. 24, you know, similar. 24, we didn't have the tax mitigation fund. We had school feasibility, capital stabilization, OPEB, and stabilization fund. I should mention back in 2018, the balance in our general stabilization fund was $800,000.
In 2018.
And now
2018, it was, and so we were in a situation where we were doing overrides. Even 3 years after the overrides, we were using free cash to balance the budget. We had very little money in the stabilization fund. COVID hit. We fired all these people in town, the town payroll. We drastically reduced the budget. We had nothing in stabilization to keep people employed. That was the mess we were in. Okay, so when I hear people say, "Oh, can't we use free cash to balance the budget?" or let's take money out of those things. That's what happens. It becomes this this snowball effect of bad things. 2003, we had $2 million we put into the capital stabilization fund to kick it off. 22, it was the same thing: capital stabilization, general stabilization, and OPEB. This year we only
OPEB was really well.
$42,000 we put in OPEB in 2022. 2021, we didn't put anything into OPEB. We didn't use free cash for anything other than to balance the budget.
That was a crazy year.
2021. So it was not used. It was not used for anything other than to balance the budget. 2020, stabilization and OPEB. 19, just OPEB pretty much. And then 18, it was OPEB.
This is saying there was no free cash left.
There was no free cash to do up. And so we had a situation where we went, not only did we not have free cash, we went a number of years not buying DPW equipment, police equipment, fire equipment. It went on for a number of years. And we had to catch up finally when we had, we had the money to put into. So it just created the history is very bad, what happens. It wasn't, we had bad habits and it caused bad problems. So
I see why that's.
yeah. All right. So that's the free cash. The local receipts, I wanted to have a conversation about this. You can see, Andrew put this together. He looked at the revenue side and then the turnback side. The revenue side, he just identified, you know, we've looked at the really long list that had like every single penny on it. These are just big items that he identified. So here he identified 86% of the items are on this one page for 2005. And you could see motor vehicle excise is the last item on here, 556. Investment income was the biggest at 598. We had some, you know, building inspections and some ambulance charges, but the two big ones are investment income and motor vehicle excise tax. And, you know, historically, there has been a pretty sizable turnback in motor vehicle excise. We talked about that at the joint meetings, right? And then on the turnback side, this, these are the sources of where we generated free cash. Okay. So we had a police department that was half understaffed for almost 3 years. That generated free cash because we budgeted for full staffing. They didn't have, for a variety of reasons, they didn't have people, and then they had problems hiring. We all know the stories, but basically there was a period of time where, you know, that was a big significant turnback of free cash. It's fully staffed now. That's not going to continue, right? You know, the other health insurance was a big turnback for a number of years for a lot of different reasons. Yeah. But we finally got that kind of you know, screwed down last year, where you can see we pretty much nailed it almost within $85,000. That was a pretty close budget. So and with the way that's going, I don't expect that to turn back big money in the future. So, you know, there's not going to be the trend on free cash, as we've all said, it's not going to be favorable, right? So I listened to Jeff last week, and we looked at the excise tax. And I think that, let me look at this. This is the motor vehicle excise tax. So this is a revised, so we revised the budget for motor vehicle excise tax. Last week, we had 2.6 million for 2027 and 2.7 million in 2028. So we've increased it $100,000. It's highlighted in green. And those, you know, the actual for 2025 was 2.8. So it's still under last year's actual by 100,000. If we increase it 100,000, but 100,000, to get to your point, Emily, every little bit counts, right? That's 100,000 split 75-25. That's an extra person to the school committee, right? If they get another 100, yeah, school department, yeah, an extra person. So the challenge here is if we make it too tight.
I get it.
And we're halfway through the year, and Andrew does his budget to actual, and we're not collecting the money. They have to lay people off to get to the budget. So it's a balancing act. We don't want to be too conservative because we're in a tight budget year, but you know, if we're you know, obviously if we're too optimistic and we're a tight budget year, that doesn't help either. So I don't know what people think. Should we leave it at the 2.6 or raise it to the 2.7? That's the question I have for everybody. Now, I should say that this is offset by in the forecast. So that's 100,000, but the vocational school assessment, based on a conversation that 15 had, went up from the joint meeting. So
Even from then?
yeah.
Okay, okay.
So I think did it go up 40 or 60? I forget what the.
So the 300 was,
What was the 300?
last time.
Up from 300,000?
No.
260. It was 260. So it went up 40,000.
Yeah.
So the 100 has a 40,000 offset. So it's really only a $60,000 increase to the forecast. You know what I'm saying? So it changes it to, I guess you could say it's 1.3% rounded. Whereas last week was 1.2%. So we're not really moving the ball there.
I mean, I don't think anyone expected it to move a lot. But
So are you in favor of keeping it at the higher number?
I'm in favor of keeping it the higher.
I think that.
And I can explain why, but I mean, I talked a lot.
Go ahead. No, what do you say? What?
Well, I guess just to piggytail on what you said before, that, and I had nothing to do with this, so really, thank you to Christine and past Warrant Committee members for making everything so much more fiscally responsible. But like, if we're not using free cash to balance the budget anymore. And so if we're having a tight year, it seems like it's not that conservative or irresponsible to increase our estimates, which we know will result in less turnbacks. But I don't think it's such a wild increase that it will cause us. I think that the worst thing it will do will just decrease the turnbacks a little bit, you know?
Yeah.
That's the way I look at it.
I think it takes away from the bigger picture, though.
I think you have to wait. Let's wait till January, see what the chapter 70 is and unrestricted government aid. And when we get down to crunch time and we needed to solve like the last 100,000, maybe that's where you look. Something like that. But I don't think it.
But we're not gonna have that, Ed. That's the thing. Like, I don't think, and maybe we wait till they officially say they want to.
It's not a
override.
Yeah.
But
it's not a normal year. So whereas we could have a crunch time in the differences because we're so far.
We're so
far away.
that was my point, was that like, I think they're afraid that, well, first of all, I don't know if they're gonna ask for override because I couldn't understand what the heck they were thinking, honestly, but
Fair point.
I'm just saying. But like, it seemed to me that we all know that has to happen. Like,
Right.
You have to at least ask for an override, but I don't know if they will, who knows? But whether or not they do, the lower number, which is the real number, which is what we're talking about, like, we can responsibly increase it a little bit. Think that.
Yeah,
I don't think this is a huge deal, and I know it's not solving any problems, but I do think it's like us kind of like trying to help them out a little bit.
Yeah.
You know what I mean? Like,
because I don't think it's a normal year. I understand your point, but we got a huge problem, and this is not gonna. I mean,
Well,
so
I say it's gonna give them a. It's gonna 1.26 will go to 1.30.
Yeah. So.
but that's a real budget going to town meeting.
But you know, I think the message though is we've really looked hard at this. We're willing to, you know, go up a little bit here, but this is it. And they need to. Yeah. What I would like to do is, if everybody's okay with this, is vote on this guidance. Okay, because I think it has to get to them via approved warrant committee guidance. Yeah, because I don't, the only thing that's going to change this is state aid, which we all know, we've agreed that it'll change it up or down one way or the other. But the sooner they identify the cuts and they start talking about them, the better off everybody will be.
Yeah.
The library is gonna be closed on Sundays.
Yeah.
We're gonna lay off 7 or 12 or whatever it is teachers.
Right.
you wanna make it concrete.
And
Yeah.
you wanna be able, the groups of parents standing at the bus stop in the morning, 6 of us or something, you wanna be able to talk about it.
Yeah.
You know, have people be like, you know,
Right.
not be surprised when they're hearing.
Right.
No,
I get your point. I can't believe that like $100,000 is gonna change their willingness to do that. But I'm as baffled as I was then as I am now.
And they have a $2 million ask, right? So.
Well, they're gonna,
Good level.
well, look, this is why
Right.
I want to vote on this, because we have to have this,
Yeah.
and they have to
No,
go,
we could vote on it, yeah.
they
if
have
you
to
don't
go,
wanna
they have to
invest
go
in it.
through the exercise of identifying, because whatever they want to do, whatever their plan is, this has to stand on its own. This
Mhm.
Prop 2.5 budget.
Yeah.
And they
I
have to
get that.
explain what the cuts are.
Yeah.
And I think the sooner they do that and the quicker they educate the residents of this town, the better off we all are.
No,
We can't-
I cannot disagree with that.
They can't be voting on their budget a day after the election. I mean, they need to
It should
come
be
out.
what the election's about.
Yeah,
That's the point of having the election before the town meeting.
right, but yeah, well,
And not to belabor a point that like, I know you're already, but you don't want to change the investment income, right? Because that was the even bigger difference between actuals. And I know you have reasons for it, but I just
Yeah.
wanted to put that on the table and then we can go ahead and take it. off
No,
the table. But, like, that was a way bigger.
that's fine. We
That's
could
way
talk,
bigger than
no, we
I
could talk about it. I mean, I think that, because I think it's very defensible what we've done. Okay, it's based upon two numbers. The first number is the average short-term cash balance over the last 2 years. Okay, of $33 million, approximately $33 million. And that has stayed surprisingly the same the last 2 years. So that one I feel very good about. There's support, there's detailed support behind that. The one that has some judgment in it is the interest rate. So if you take $33 million times a 3% rate, you come up with the budget of 990, whatever the number is. That's what the interest income budget is. And the interest rate of 3%, I mean, we'll know tomorrow what the Fed's gonna, it looks like they're gonna cut again, so they'll be at 3.5%. And we're talking about budgeting 18 months out. So I would not be in favor of increasing that 3% rate, if that's what you're talking about.
Well, I'm not as educated as you are on that subject. I just know when I look at the actuals, we were at 1.3.
Yes, because you know what was happening was remember when rates were like 2%?
Yes.
And we didn't borrow money in the school? We were investing,
some salt.
we were investing cash at 2%, right?
Yes.
And then the rates went up, but we didn't increase, we were conservative, we didn't increase our budget. We kept the budget really assuming we were going to earn 2%, and we were actually getting 4%.
Right.
That's why there were those big differences.
Nobody expected it to go to such crazy inflation.
But it went way up. Now it's going the opposite way, so we have the opposite problem. But that's what happens, in the past, and
Interest rates continue to go down.
They were never gonna get lower than.
Then
what they
you've got
were.
more downside likelihood than you have upside
Totally.
likelihood.
They're gonna totally
Yeah.
deal with it.
Because you got more downside risk.
All right.
that's what I think.
Yeah, I mean, I just look at my, accounts, and I've got 4 straight months of, we're adjusting your HISA rate downwards. I mean, I think it's just gonna continue.
Yeah.
So.
All right, fair enough. I just wanted to bring it up. That was the other big ticket. But
Okay,
I agree.
okay. So is everybody in agreement that we could vote on the 1.3%?
On this page
Or
here.
do we need to have to talk about it more? So on the revised forecast that has
1.29, 1.26.
it has the higher 100,000 higher excise tax in it and the higher vocational assessment. Okay, which brings it up to a rounded 1.3%.
Right, so the 59,829,657.
Right.
Yep.
Okay.
Sorry, what 59,829,657. Yeah.
Right. 27.
All right, so let's take a vote then. So I'd entertain a motion then to approve this revised forecast
Motion to approve the revised forecast.
showing a department increase of 1.3%. Is there a second?
Second.
Okay, so all in favor, say aye.
Aye.
Okay. Okay. So I will send a email out tomorrow or the next day to, like I do every year, to all the budget makers.
Right.
I'll copy.
I'm sorry, is that across the board, town and school?
Yes.
12.3.
Yeah. Yeah, everybody. Yeah. And this year I'll make it a little different because I'll direct them to identify the cuts. You know, I'll attach that schedule that we had at the joint meeting with the timeline to it, so they can see what timeline we're looking for. Okay. Sorry, did you have a comment?
No, I just wanted to know, thank you to Brittany and Andrew and you and Christine for, like, since the joint meeting, putting all this information together specifically on OPEB and the Cook Consulting and free cash so that we could get to this vote and address kind of the questions as well.
Yeah.
I think, you know, it's a very meaty meeting, and with great information.
Totally. No, just to be clear, on 1.3, this says 1.29, 1.26.
Yeah, I know.
Can we just be clear on that messaging?
I will two decimal
I
points.
think so.
Yeah, I'll take it up 2 decimal.
I just didn't want to say, oh yeah, it's 1.3 if it's 1.26, 1.29.
Yeah, the spreadsheet up top rounds it to 1 decimal point, and then the departments have it at 2 decimal points.
Yeah, roll covers.
Yeah, I'll make that clear in the email. Okay, is there anything else on that forecast? I think, if not, there is a upcoming. So there was a proposal that we put out. I did it actually. I tried to see if we could have a meeting with at the end of the blackout meeting.
Oh, I like it. I name.
The blackout meeting, we had, I forget who made the suggestion. I think it might have been Gus. Like, why don't we have a second meeting?
Yeah.
And I threw out January 13th as a date, but I got an email from, because that happened to be a date we were meeting. So I was like, well, there's 9 of us, so let's see if we can do it then. And Michelle Kirkby, if I got forwarded an email from Michelle saying that they're having trouble getting a quorum on that date, on the 13th. So, but I guess they were sort of wondering like what the purpose of that second meeting would be. They think they felt like they got the message that.
Okay.
Oh, they did, okay.
Well, I mean, I think felt like the key information related to the budget challenges was already shared. Is kind of what she said.
But there was no action on it.
Right.
Yeah.
I mean,
I guess her suggestion was maybe that we should think about what the agenda should be for that segment.
Well, I thought the thing that came up for me at that meeting was someone said it might have been you, Ed, was that if this is a structural problem that has a multi-year structural problem, and we're trying to argue over 1.26, 1.29, $100,000 here, $100,000, we're not really having the right conversation,
right.
Which is how do you address a structural problem within, the constraints that we all have. And even the OPEB discussion was about, well, maybe we don't fund the liabilities for the retirement by paying for the healthcare today. I mean, it's so crazy. It's a circular reference that these are structural problems where if you're going to try to have 75% of the budget go to the school and the school can't but have the same level of service at 5% year over year.
Mhm.
That's never good. That actually doesn't work even without the healthcare. It was a
Right.
broken budget even
Right.
without the healthcare, was a surprise to me. Was they would have needed an override even if healthcare costs were flat based on their own level service analysis.
Well, Prop 2.5 just doesn't work.
Well, no, they were saying that they have more than 2.5% inflation costs when inflation is not more than 2.5%.
So
So,
had that for multiple years.
so,
Yeah.
so that's, I think, a
We all
structural
know
problem.
that. Yeah.
Well, I didn't know that until that meeting, that they have, a 5% level service inflation, which was surprising to me.
I will
Well,
say
last
they
For
all.
a few years, we've given them 3 to 4 to 5%, and it's been a struggle. So
Three,
it,
three and a half, 3.5 last year.
but
Yeah. There was one year we did 4, then it was 3.7.
But
Last
that's back
year
when there was more
3.5.
inflation. This year, inflation
Their
is down.
payroll,
But
there
okay,
has to be an override. And Steve is right, like, they need to identify their cuts and they need to communicate. I just like don't have a lot of confidence in that. Sorry to say that publicly. but,
that they want, that they
I
won't
don't-
support an override.
Yeah,
Yeah.
I don't see like them,
I was real surprised at that meeting.
I
I
didn't-
thought they'd be the ones jumping up and down saying we need an override.
Yeah.
And it was the dog that did
I get-
bark.
Well, I
know.
think talking about what those cuts are and making it real to people.
Yeah, you're very practical. I'm a little more emotional, but the way I see it is that like, I think that we have a vested interest in this. We're the warrant committee. We have to go sit at that town meeting, right? And like, I would like to know, I would like to hear that like, there's a plan to communicate the cuts and explain why we need an override
Well,
for
even,
this and not to just shy away from it because of fear around school passing or whatever, because that game, I don't think we should have played that game last year, but that's where we're at. And it's getting, every year we avoid problems. And Mike Quinlan said that July 1st meeting, and he was one of the few people that publicly said that like, this is bad. We have put ourselves in a terrible position because nobody wants to put their neck out. And I get that it's easier for us because we're not elected and we don't make those decisions, but I would like to hear someone like take accountability for that.
I mean,
That's what I would like
Yeah, okay.
personally. I don't know. if you
okay,
guys
so
agree, but-
I think a couple thoughts. One, that, the school department and the school committee they are in the midst of a negotiation on collective bargaining. So there's that behind the scenes that they're trying to negotiate that contract for 27. They're trying to do a one-year contract and then a 3-year contract. So it's complicated because that negotiation is going on now. They haven't settled it yet. They don't know where it's going to end. So, but I do think, so I'm not sure. They may have reasons why they're not saying certain things or doing certain things. I don't know what they are. They haven't shared it, but
going to do a budget, you don't know what the number's gonna be for, the
biggest-
cost of living increase.
yeah,
You
the
don't know
biggest
what
driver is going to be that collective bargaining.
Remember, they've been dealing with 2%. Very
I see.
the last couple of years.
so they don't even know what's driving their own numbers.
Well, they're negotiating.
They're
They're
negotiating.
negotiating.
They're
All
negotiating.
right, well, that's clear.
So that's
Yeah, but that's still like potential increase off of already bad problem.
That's what.
but it's 80% of their budget is people, and that cost of living is a big number.
No, that makes a bad problem worse. That doesn't make no problem worse.
Right.
Yeah, the 0.3% we just voted on is not gonna.
The 1.3 is not going
Yeah.
to solve their problem. No, I agree. So anyway, I think though that we'll know hopefully by the next time we meet with them whether they want to support an override.
So as we
Now,
read
keep in
this
mind-
meeting is January 13, a regular warrant committee meeting?
Well, okay,
Meeting
so
where we don't know.
they can't meet on the 13th. So
Okay, so
There's
We
also
will,
a
but-
chorus concert for the schools that night.
there's a chorus concert that night.
So I think
Okay,
that could be a.
that might be the
Well,
softball. Yeah.
I know it's.
That's huge.
So I think they're trying to. Oh, did they offer another date? I forget what the date.
Oh, they did,
did,
they meet that Thursday.
So they meet on the 15th, which is that Thursday. Does that work for everybody?
Does it
No,
make
but it's
sense-
better.
See, does it make sense to have a joint meeting after, oh, I don't know, I forget that date. What is the date in the middle of January where they're gonna know when they have to say, these are my cuts, this is all I'm gonna get from my level service down to 1.3. And then after that, have a joint meeting. That's a joint meeting that would attract a lot of townsfolk to answer a lot of questions.
Thank you. That's what I was thinking. We
That's, I
shouldn't have
think if
another
we
one.
move it to that, to someplace, and that would be almost like a kickoff as to this is what we're facing in town, and it's still the third week of January, whatever it is.
Yeah,
So whenever,
That's the initiative driver thing.
I believe he's been there.
yeah, keep in mind, there's also the town side of this too, right?
well, the
So
town, yeah, the town by then will all, I assume.
Town will know. They'll know what their
So what
numbers
if we
are.
just move it to
So-
the next warrant committee meeting?
We could do the 27th.
And we'll still meet.
I was
we'll
just
still be
trying, I was
24
trying
hours.
not to push it to the end of the month. It's like a long time to go.
It is.
without, but
What about the 20th?
Well, what, push what to the end?
push this joint meeting.
Oh, the
to-
joint meeting?
Yeah.
Yeah, somewhere in January.
But I have that
After,
thought.
after the schools and the town know this is how I'm gonna get to my number.
Yeah, yeah.
So that can be talked about at that meeting. 'cause
Okay.
That will attract attention.
Yeah,
They have the school committee has their budget hearing as well.
that's at the end of January. Right. Yeah,
I apologize, I'm not remembering. I think you said there's a date by which,
the 13th is the date that the warrant closes.
so
Of
if you
January.
wanna have an override, got a signal by that date.
Of
that
January.
You want an override.
That was
Yeah.
our placeholder date, yeah.
But that's just having a placeholder in the warrant.
Yes.
And,
need to know
you know, the select board could put one on
As a placeholder.
as by themselves as a placeholder, and then it could always come off or drop. Be
Yeah, we
dropped.
don't need to know amounts.
Okay,
We
okay,
just
okay.
need to have that. place
Yeah.
on front.
Can I ask a point of clarification? Who would be the group that would be doing a warrant on the capital budget for the replacement of some of the school roofs or whatever, something related to the Arrow Street? If that's the select board's job to say, hey, we want to do a thing, or it's the school committee to say, no, we need an over, or it's the capital budget committee that says we need money to build for the schools. It wasn't clear to me today as we talked about the capital for the stabilization fund for the school building stabilization fund. Who's was responsible for making the call? Even the guy on the up wasn't clear who is the powers that be of making
I think it got to come from the school department
the school department.
and the school committee.
Okay,
I think it's their building, so I think it has to come from them. Yeah.
I just, let's be clear on that.
Okay, so is there anything else that we are on? So that meeting, I guess I'll try to do something in January, maybe towards the middle of the month,
Yeah.
but less. I'll try to stay away from the end of the month. And then in terms of agenda, I like your idea of like having the agenda be what the cuts are.
Yeah.
And then we should like.
This is what we're looking at. At this point in time, this is what we're looking at. We'll have the statement of the governor's number for
Right.
that. So
When do we expect that?
Well,
usually
the-
for a second week of January.
well, the final one is the end of January, January 30th.
Oh, all right.
Yeah, so we might not have
Might
that.
not have
Yeah, we might not have that. But at least they can kind of, maybe they won't have the nitty gritty details, but they can talk about, summarizing cuts in
Right.
different areas and what they're thinking. I don't know if it fits in their schedule. That's the only thing. I know the towns, I think Christine would be ready to do that. She already knows. The school, they just have a different process and,
Oh, I know.
they seem to take longer, but
If state aid is below what's in the budget we just raised our hands on, we have to come back and change the
say
numbers?
it's- Say it's 1% there.
Yeah, we just change the numbers based on it?
Yeah. Okay, so,
Can you get to it?
I think,
all right, so committee update, school building committee.
no.
I'm gonna go home.
He's got a-
I need to leave now. That's my bedtime. We're holding fire, hoping that this Friday, the 12th, is the day that they vote on module 1 and allow us to get module 2, which is picking a project, an OPM, a project manager. which has to happen in the scheme of MSBA world relatively quickly, has to be done by, if we are approved December 12th, it has to be done, I think, by March 30.
They voting is MSBA.
MSBA, yes. And so we are not guaranteed that they'll reach us this Friday, but we are hopeful. Things have been communicated to Jeff Morrison suggesting that they will be. So that's potentially good news, and actually, if you want me to, if I hear from you, I can send out an email to the Warrant committee, just so you guys know.
Sure, yeah.
Would you use the same project manager
Same project manager.
as last time?
Oh, Lord.
It's a bid again, right?
Well, it was to be a project.
Gotta be a simple vote.
I mean, we have to, there's, as I understand it, and believe me, I don't pretend to understand it well. There's a selection process that is laid out in some detail by the MSBA. And people will be allowed to do some kind of an RFP, which is almost written for us by the MSBA. There are a few things we can tweak to, and then we get submissions, and then we have to boil those submissions down.
Jeff just responded here that our public hearing is January 30th. Oh, their public hearing for their budget.
For their budget, January 30th, yeah.
Jeff is watching this.
So there's
What, they
no
gonna
way-
discuss
no way
anything
to do
with
it.
us?
Yeah.
You can't do it in the middle of January, it's got to be
Yeah,
February. Right, whatever.
yeah.
It's gotta get done at some point.
Right.
So that's good news. That you must be excited. Things are gonna finally start moving. That's great. Yeah. Great news.
Well, we're genuinely hopeful it'll be good.
Yeah. All right. Okay. Anything else? Any other questions from the?
No, that was the only time.
Sorry, I missed last meeting. Budget outreach and discussion with departments.
Oh, yeah.
Been assigned. Do we want to start that early January? Or now? If we
I
maybe we
think,
need to give it this year.
well, this guidance is going out. You can make contacts with them. They won't have final numbers probably till January, but I think you could start the conversations, yeah. I mean, Christine I don't know how far she's gotten with some of the discussions of
We should
where
we should
cuts would
wait
be.
and do it maybe like early January.
Yeah,
I feel like that's when it happened last year.
I mean, Christine is gonna be, I'm guessing, Christine and Brittany are gonna be well ahead of the school department.
Oh, yeah.
in making them figure it out and get realistic
Right.
assessments.
I don't know if we have there's who are scheduled yet, but
I heard they're
I
all
think
scared.
department heads come in. Will be mostly February. Will we invite them in again? Majority of them?
yes, we will. I think, I would like to streamline it if we can. If there's a department where there's no change in personnel and there's no change in our.
Right, we don't need to have a.
We don't need to have a conversation.
I always feel,
Okay,
But the ones that have cuts,
I don't know if you just heard Ashley made the point. the
Library,
doesn't
building
change much from
permits,
year to year,
like-
making.
it might this year, so that might be one we actually have, meetings with. If there's cuts, that,
Right.
Okay. I mean, we will, our next meeting is in January, so I will let people, early January, I think it is, I'll let people know then.
Isn't it
I think it's the 13th.
Is that the first meeting? We're not meeting on the 6th? Okay.
I
No,
don't
the
know.
select board meets.
Oh, select board 6th, okay, so it's,
That's what I just want to make sure. We don't have anything prepared for the 13th.
no,
We'll meet.
no,
Okay,
no,
great.
no.
Sure.
All right, everybody have a wonderful Christmas. I would entertain a motion
I
to
think
adjourn.
Christina is going to prepare to bring more information for the 13th meeting. Full numbers
Okay,
according to our chart.
you have to, yeah. Okay. So, All right.
Motion to adjourn.
Motion to adjourn, second.
Second.
All in favor?
Aye.
All right, guys. You stop, you can stop the.
So, 10, what meeting was like this, we get time and a half.
Oh, yeah.